And I gave yesterday 3 appointments from 8 in the morning until 3 in the afternoon. So good afternoon, everyone. Thank you so much for being with us today. The committee welcomes you. We're going to have bill hearings for the House Health and Government Operations Committee. I'm your chairman, Jocelyn Peña-Melnick, and I have my wonderful vice chair, Delegate Bonnie Carlos, and to my left in the attorney today, Ms. Lindsay Rowe, who is wonderful. I want to thank staff for getting us all the paperwork and everything before this hearing. I kindly ask of you that are with us today that if we encounter any technical streaming issues, which sometimes it will happen, not often, just be patient with us because we will take care of it, okay? Please set your electronic devices, and I'm looking for mine right now. Put it on silent. I just did. Watch me be embarrassed. No, I just did. Make sure that you do that. And if you need to speak, make sure to go outside. I want to thank our state trooper for being with us today. Thank you so much. As a reminder, there's no food or drink allowed in the gallery. And the reason is because then staff has to clean it and that's not their job. And we don't want little special critters here, right? You will see us with drinks, and that's because we'll sit here for hours and we need to stay hydrated. And that is the reason I'm going to tell you how the process will go here. For each bill, we're going to hear from the bill sponsor and the sponsor panel, followed by an all in-person witnesses. So it will go this way. Favorable with amendment, and unfavorable, then all virtual witnesses. We do the people that come first, and then the virtual witnesses will be the same favorable with amendment, and unfavorable. The bill sponsor testimony in this committee is not limited. While all witnesses have 2 minutes to provide testimony, but that doesn't mean that you abuse it, because if you took too long, I'm going to stop you respectfully. A timer is displayed on the screen and a sound will play when your time has expired. I'm not rude. I'll let you finish your thought, okay? And wrap it up. Bless you. Please adhere to our usual committee rules of 1 question and 1 answer for a wonderful committee. And thank you for coming on time. I really appreciate you. And please keep your questions brief. Members of the public will be able to view the live stream of this hearing on the Maryland General Assembly website and the YouTube channel. Today, we will hear the bills in the following order. However, please keep in mind that there are some members that have bill hearings in other committee, and I may have to switch it around as I see the necessity. The first bill will be Baltimore City Delegation. It will be presented by Delegate Smith, and it's Public Information Act Surveillance Images Illegal Dumping in Baltimore City. The second one will be House Bill 418, then followed by 431, followed by 380, 368, 354, and the final bill of the day will be House Bill 425. I would like to call House Bill 387 first, please. Will you be so kind, Delegate Smith, and bring your panel? Thank you so much. How are you?
Okay, great. I couldn't see a light. Good afternoon, Madam Chair, Madam Vice Chair, and distinguished members of HGO. For the record, I am Delegate Stephanie Smith, and I'm here to present House Bill 387. This bill was introduced as a courtesy to the Baltimore City Delegation leadership. Mayor Brandon Scott's team is here to support me in this effort. I think many of you are aware of how prolific dumping is across the state, and in certain areas it's even more acute. And as you know, some of you who may have been here in 2005, the Maryland General Assembly did empower the city of Baltimore to be authorized to install various surveillance cameras and so forth, so that we can better identify and apprehend those who are engaged in illegal dumping. Unfortunately, there are some limitations to our existing enforcement efforts, despite having really dedicated enforcement personnel and staff and some level of surveillance activity. There are still limitations around identifying license plates and other things that could help us better identify who's actually dumping in our communities, and particularly at some significant levels. In many ways, there are businesses that are essentially factoring in not properly paying for dumping as part of how they do business. As we know, this is not fair to the residents of our city, and it's also incredibly frustrating for city personnel who really want to hold bad actors accountable. And so I'm joined by leadership from our city who are working on this very issue and will explain how this bill will allow us to more publicly share these images so that we can better identify those bad actors. So I thank you for your careful consideration of House Bill 387 and do hope for a favorable report. Thank you so much.
You're welcome. I know you have other hearings in other committees, so so you'll stay, okay. Next, please.
Thank you. Good afternoon, Madam Chair, members of the committee. My name is Stephanie Murdoch. I'm the Director of Legislative Services for Baltimore City DHCD, and I'm here on behalf of the administration in support of House Bill 387. This bill would allow DHCD's Special Investigations Unit to publicly disseminate photos of suspects captured on illegal dumping cameras in an attempt to identify them and reduce the future reoccurrence of this activity by an individual. Our Special Investigations Unit responds to, on average, over 10,000 reports a year of suspected illegal dumping and works tirelessly to investigate the large-scale dumping complaints and to criminally prosecute illegal dumpers when they have enough evidence to do so. The agency owns and operates over 100 motion-activated cameras and has investigators working daily to monitor and investigate the dumping captured. While useful in many instances, cameras do not always capture a license plate if a vehicle is used. However, the cameras do often capture faces alongside the vehicle. This bill would allow Baltimore City DHCD to utilize social media to solicit community assistance in identifying suspects in a manner similar to what the Baltimore Police Department's Metro Crime Stoppers do. Dumping is a crime, and we need the public's assistance to identify and curb illegal dumping. We ask for your favorable support.
Thank you. Next, please.
Thank you. Good afternoon. My name is Seth Greer. I'm with Baltimore City Department of Housing Community Development. Want to thank you all for your time today. And the Department of Housing Community Development and our Special Investigations Unit consists of 11 investigators and 1 director who are in the streets every day to curb illegal dumping in Baltimore City, which is what they are sworn to do. SIU responds to over 10,000 311 complaints, as Stephanie said, and responded to 15,000 in 2023. Each one requiring an investigator to respond and find information in illegally dumped items in hopes of finding a suspect. But as Stephanie said, our cameras don't always catch all the information that we need, and being able to disseminate these photos to the community and continue to work with the community to further that partnership would go a long way in our investigations and in our trust with the citizens of Baltimore. So we would ask again for respectfully request a favorable report on this. Thank you.
Thank you. There's someone else from the mayor's office here. Tell me your name again.
Stephanie?
Stephanie Murdoch.
Stephanie, there's Nina.
Oh, Thimless.
Yes, is she here?
I don't believe so.
'Cause
She's the Director of Government Affairs,
Yeah,
so there's
she's-
multiple.
She signed up to
okay.
testify in person, so just want to make sure we got the whole panel.
Mhm.
So thank you for being with us today. We really appreciate it. We are now going to open it up for questions from the committee. I see Delegate Woods, followed by Rosenberg, followed by Johnson. Go ahead.
Thank you, Madam Chair. Thank you for your presentation. I just, out of curiosity, am wondering, are there any incentives, since you're asking the community to help to identify illegal dumpers through social media? Has there been any incentives for the community?
I wouldn't say there's incentives per se, other than having a more beautiful and clean community and having your alleys and lots clear and free of debris. There are penalties that illegal dumpers can face that are quite serious. So specifically to entice the public to participate related to this, no, but that could be a possibility in the future.
Sure.
Yeah, I was going to suggest that maybe that is something that you think about. I mean, it doesn't have to be greatly detailed, but people always appreciate that they're helping, and it may generate more support. Thank you.
You're welcome. I have Delegate Rosenberg next.
Thank you, Madam Chair.
My pleasure.
I hear from many of the several of the communities in my district about dumping problems. So this is an issue of, it's a real issue and really affects the well-being of a neighborhood. Why did you choose to ask us to get rid of this entire provision of law as opposed to, and this would affect every jurisdiction in the state or just Baltimore City? I saw one provision, C is just the city, but if you could answer those two questions, if I could be permitted two questions.
You can, you don't ask often. It's okay. Go ahead.
Thank you.
Who's the best person to answer?
Well, the
it?
best person, I'm not sure, but our understanding from what is being requested is just specifically for DHCD in Baltimore, not for the state at large. Any other, government's ability or any other existing abilities for them to be able to disseminate their photos should not be messed with.
You want your follow-up?
Oh, I was asking two questions here at the end.
Okay, all right.
It felt
You're
like
welcome.
one.
I have Delegate Johnson followed by Delegate Lewis next.
Thank you, Madam Chair, and thank you. I really like this bill and I wish it was a statewide bill. My question is, out of the 10 to 15,000 complaints you get, do you know approximately what percentage of those that you do solve? And will the tips you get from the public be anonymous?
As far as the ones that we solve, so just to be clear, the 10 or 15,000 are citizen generated complaints that come in through the city's 311 system. So those aren't our illegal dumping camera, those two separate issues. So as far as when our investigators respond to the 15,000 311 complaints, they're going out digging through trash to try to find evidence of maybe who did it, and we issue citations based off of those. As far as being able to submit these photos, we would say there's probably on average 5 to 10 instances a month. Our investigators are going out to their cameras sometimes 2 to 3 times per week to download that footage. And there's roughly 5 to 10 on average a month, rather, where we're finding footage where maybe we only have a partial photo. So being able to disseminate those photos, we believe would severely lower that number per month of cases that we can't further an investigation on.
Sure, go for it.
Ask it all at once, but so will the
I'm very
public's,
generous today.
thank you. Will the public's input, will that be anonymous?
Well, not for a criminal case, because they would need to come and testify. And we let them know that up front, if they are able to identify. Now, if they're just going to submit some information on who they might know, it might just be some information to us that we can take forward and wouldn't necessarily need their testimony in court. So it depends.
You're welcome. I have Delegate Lewis.
Thank you, Madam Chair.
You're welcome.
Delegate Smith, I am so pleased that this proposal is before us. And thank you to DHCD for taking leadership. As someone who was a longtime neighborhood leader and making 311 calls back before cameras, surveillance, I can see the potential for this bill. My question is this: right now in Baltimore City, probably every neighborhood, but some more than others, have been used as the region's trash cans with illegal criminal dumpers coming from other parts of the city and state. It's a well-known pattern. We are already familiar with the use of surveillance cameras of various technologies. A particular brand, Ring cameras, come to mind. They're used for doorbells. They're quite common, and they're being used in a collaborative and organized way by many neighborhoods to share visual data about activities that may be construed as criminal or threats to public safety. And they're being used; those images are being used successfully in those sorts of criminal related cases. Are we looking at an opportunity to direct the use of those technologies for honestly, for those of us in Baltimore, an uplifting and inspiring action, using cameras to keep our neighborhoods cleaner. Do you envision a similar rollout where communities will collaborate and network cameras to do surveillance and identify hotspots and get faster action?
Well, I would say our investigators and DHCD as a whole, I think we take pride in working with the communities closely in that way. And we do talk with community members every day about certain spots. And if it is an area where we're allowed to surveil, we will with our cameras. But we actually, to your point, madam, we did have a successful case in court with a citizen providing Ring camera footage and being able to prosecute those people. For sure. But as far as a collaborative effort, to get maybe block captains together to do that sort of thing, we would certainly welcome that. The community asks us for a lot, and we certainly want to have that partnership with them. So I think that would be a great idea.
You're welcome, Delegate Chisholm, followed by Delegate Hill.
Thank you, Madam Chair, and
You're welcome.
thank you, Delegate, for bringing this bill. This might be a stupid question, but are the
There's no
cameras?
such thing as a stupid question.
Okay, they said no stupid questions, just stupid people, so I'll be a stupid
No,
person.
not that either. I'm gonna take care of you. Since you're not doing it.
No, don't
You're
do
not stupid. Go ahead.
Are all the cameras shared? And why I ask that is, does DPW have access to all of the police cameras as well?
No, and so DPW is a separate arm of, that's not DHCD. And when you say shared, as far as anybody having access to them, well, no, we do not. I mean, we could coordinate with somebody to get them, but as far as our investigators are the only ones that can go and pull our surveillance camera photos, and they're not in a system like with the blue light cameras or anything like through BPD or anything like that.
Be that some of those cameras do have very vivid images, and they can.
They do.
And the problem you're facing now is a lot of the images you either don't have actual visual evidence to go after somebody, or the images you have now are just not clear enough to figure out what a license plate is or who did it.
Well, and I would say, so our director for our special investigations unit, who is here, has been working hard on getting better technology. I would say you really would be surprised at how far they've come. We really do get some very clear images with our cameras. It's more of the technology on the timing, what those cameras can focus on while they are taking their pictures, because they are motion activated. So they have actually come a long way. I don't necessarily feel like the quality of the picture is what we're battling at this time.
And so, you're welcome. And so that, Mr. Greer, Delegate Chisholm blossoms. That was a great question, wasn't it?
It was
very
fantastic.
good.
Wonderful. Delegate Hill.
Thank you, Madam Chair. And this is for Delegate Smith.
Mhm.
I want to follow up on the subcommittee chair, Delegate Rosenberg's question, because it looks like what is being removed from statute, what's being rescinded, is the entire 4322, and only a small part of that refers to Baltimore City. And I agree with Delegate Johnson. I have no objection to doing this
Right.
statewide, but I would like it if you could take some time before
Yeah.
subcommittee
Yeah.
to make sure that this is the way you want it, that it is specific. for Baltimore
Absolutely.
City.
I think it's important to take that closer look so that it's exactly what I think they intended, to only implicate Baltimore City, and perhaps next year other people might be interested in something broader. Thank you so much, Delegate.
You're welcome. And I believe those are all the questions from our committee. I want to thank you for being patient as we
course.
asked them. And the only thing that I need that I do not see in the file is the Baltimore City letter.
We're hearing it this Friday.
Okay.
Yep.
Wonderful. As soon as you get it, then we'll take care of it, okay? And it will go to
Absolutely.
subcommittee, so make sure that you're able to come, all right?
Thank you, Madam Chair.
And I hope you have a blessed day. Thank you
Thank
for
you,
being
you
with
too.
us.
Thank you to the
Thank you.
committee.
You're welcome. So this actually concludes the bill hearing on House Bill 387. Next, we have House Bill 418. Speaker Pro Tem, Delegate Stein, will you bring your panel, please? grant applications and reporting Maryland Efficient Grant Application Council alterations. Good afternoon.
Good afternoon, Madam Chair.
How are you?
Good, thank you. How are you?
I'm doing well. Thank you for asking. You can get started.
Sure.
Mhm.
So Chair Pena-Melnick, Vice Chair Collison, and committee members, it's nice to be before you again. With me is Melanie Shapiro, who will be testifying, as well as one of our witnesses who was going to be testifying in person, unfortunately is sick, but he will be testifying virtually, Henry Bogdan. So, Madam Chair and Vice Chair, back 4 years ago, this committee and the legislature established what's called the Maryland Efficient Grant Application Council to help reform the state's grants process. This was in response to the fact that across state agencies, the grant application process and the financial reporting process can vary considerably, leading to inefficiencies and inconsistencies. So the council was tasked with reforming this process by creating a standardized application and budget format for grants. By doing so, this would eliminate unnecessary paperwork for nonprofit applicants and in the process make delivery of services more efficient. The council was to report its recommendations to DBM by July 2024. However, due to COVID and the lack of staff support from the previous administration, the council has been unable to complete its report. So this bill would extend the council's termination date from June 30, 2025 to June 30, 2028, and extend its reporting deadline to July 1st, 2027. It would also add the comptroller or controller's designee to the council members. And it would have the council study and make recommendations on the creation of a state grants ombudsperson within the governor's office to provide technical assistance to nonprofits who are accessing, navigating grant programs, resolving delays, and other related helpful functions. With an amendment that is before you, the amendment removes the legislative auditor from the provision of the bill that would have added someone from the auditor's office to the council and specifies that the governor would appoint the chair of the council. And with that, Madam Chair, I urge a favorable report. Thank you.
Thank you so much for the amendment. We did notice that in the fiscal note. So thank you for addressing it. Next, please.
Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. My name is Melanie Shapiro. I'm the Public Policy Director with the Maryland Network Against Domestic Violence. We are the federally recognized state domestic violence coalition in the state of Maryland, and we advocate on behalf of comprehensive domestic violence service providers, other non-comprehensive domestic service providers, most of whom are nonprofits. We are here in support of House Bill 418 because of the burdens that are placed on nonprofits, our members, in the filing of grant applications. Just the other day, I was with one of our member programs executive directors who was indicating that she needed to go back to the office because she had to submit the same form multiple times to the same agency, all on different grants. The ability to streamline this process is imperative to allow nonprofits and victim service providers to do what they are intended to do, which is to provide services to victims and not be overly burdened with the process that is currently in place. We think that certainly support the sponsor's amendment, and we think that the additions of the additional members as well as the ombudsperson would be of great benefit to nonprofits in the state of Maryland, and we urge a favorable report on House Bill 418.
Thank you for your work and testimony. And next we have, actually, he's favorable with amendment. Is it the same amendment as the one you have? All right, so let's bring him up. Will you be so kind, please? Thank you. And then we'll open it up for questions, okay? He's in. Good afternoon. Can you hear us, Henry?
Yes, thank you.
Henry and I can call him Henry because we've known each other for 18 years. But Mr. Bolt, good afternoon. How are
Thank
you?
you, Matt.
I hear you a little bit under the weather.
I'm doing well. I appreciate, thank you very much. Madam Chair, members of the committee, for most of the time I've known the chair, we've been involved off and on in trying to make changes and improve procurement and grants for nonprofits providing services. 4 years ago, your committee, the Senate committee, and both houses of the legislature, without dissent, approved the bill creating the Maryland Efficient Grant Application Council. Unfortunately, creating this thing at the beginning of an international pandemic was not the best timing. As the sponsor alluded to, the pandemic effectively diverted staff and resources in all the agencies. The governor's grants office consisted at that time of one or two persons, went down to a half person for different times. The council did accomplish some parts of the mission, at least in getting started, at least as staff were available. It did assess and record and report on the numerous issues and problems there were to be addressed. It recommended prompt payment legislation, and we thank this committee and the legislature for passing that bill last year. And it had also begun to look at trying to come up with common definitions in terms, which is important in trying to standardize anything. As far as at the chair's direction, this bill was discussed with the governor's legislative office. The fact that the director of the governor's grants office is going to be assigned much more responsibility in terms of trying to maximize federal grant attainment. It was agreed that that was no longer the appropriate person to be serving as chair. And this legislation would provide, by the amendment that's been offered, that this will be a gubernatorial appointment going forward.
You can finish your thought, Henry.
No, I just want to thank the committee for your support. I think this is an important way to commit the new administration and agencies and the nonprofits to moving forward and trying to make this whole system work better, so services can be delivered more effectively to the people who need them.
Thank you. Thank you very much for being with us. So now we're going to open it up for questions. Are there any questions for this panel? Delegate Woods.
Yes, so thank you very much for the presentation. I have a question as it related to you talking about altering certain reporting requirements, and hearing you say that you saw a barrier because someone had to give the same information to multiple people. Have you all thought about a system whereby people could pull from that pool electronically? So once needed information goes out, multiple different systems could pull that information.
If I may, I mean, I believe that's part of the hope that the council will be able to come up with systems that would facilitate that process, but it requires an organization like this council to, there's multiple different agencies, there's different requirements for different grant reports, but if a nonprofit's submitting their 501c3 status, there should be able to be stored somewhere so that it can easily get pulled. But that is our hope and intention for this council, to address all of these things so there's a commonality across agencies to remove some of the burden from the grantees.
You're welcome. Any other questions for this panel? Seeing none, thank you very much for being with us today. And
Thank you.
This will conclude the bill hearing on House Bill 418. We're moving along. We have House Bill 431. Delegate Pruski, will you be so kind and bring your panel, please? Department of Veteran Affairs, renaming and Deputy Secretary of Military Family Policy and Programs. Good afternoon. Good afternoon, Mr. Secretary. Nice to see you.
Good to see you too, Chair.
Will you get started? Hi, Delegate. How are you?
I'm great. Good afternoon. Thank you, Chairwoman Pena-Melnick, Vice Chair Collison, and to the committee. Delegate Andrew Pruski here to testify on HB 431. HB 431 renames the Department of Veteran Affairs to the Department of Veterans and Military Families, and also renaming the Secretary of Veteran Affairs to be the Secretary of Veterans and Military Families, and also requiring a secretary to appoint a Deputy Secretary of Military Families, Policy, and Programs. Why would you make this change? The current Department of Veteran Affairs advocates clearly, not only for veterans, but active duty service members, and they are important, but so are their families. While there have been efforts to support veterans and families, we can certainly all want to do better. We recognize the impact of our service members that are deployed, working, that work in our local community and in our state. Governor Westmore and Secretary Woods and all the advocates, including veterans, want to support our families. Maryland has always been proud to welcome veterans, both active duty, reserve, in our state and our local community. We need to continue to be a leader, and this bill makes that happen. There is a fiscal impact. We're not only changing names, but we're offering a service to those and their families by adding a deputy secretary. My hope is that you see this legislation as an investment to make sure that we continue to support our veterans and families. You'll hear today from Secretary Woods and several advocates that why this bill is so important and the change. I want to take an opportunity to thank Governor Westmore, Secretary Woods, and every advocate that wants to do better for our military and our families. I ask for a favorable report for this bill and hope that you help further Maryland's goal of being the best state for veterans and their families. Thank you.
Next, please.
Chair Pena-Melnick, Vice Chair Cullison, members of HGO, thank you so much for having me here. I'm honored to appear before you today, and I respectfully ask the committee for a favorable report on HB 0431. It's a bill that renames my department to the Department of Veterans and Military Families, and I'm grateful to Delegate Pruski and Senator Guile for introducing this bill and its cross-file. I'm Tony Woods, Secretary of the Department of Veterans Affairs, and I'm hopeful that this title changes by next year. It's a privilege to lead this department. My department's mission is to assist veterans, active duty service members, and their families and dependents in securing benefits earned through military service. This has been the case since 1999, I would add. In my first year in this role, I've had an opportunity to listen to many from those communities and more. While my department already serves Maryland's military families, I understand that we are not doing enough. It's something that came through very clearly. There are real challenges associated with the military lifestyle, and the state of Maryland has a really important role to play along with the Department of Defense. Blue Star Families is a prominent advocate for military families, and they have illuminated the numerous challenges faced by veterans and military families. Their annual military family lifestyle survey exposed financial hardships, housing concerns, food security, and disproportionately high unemployment rates amongst spouses. These issues are compounded by the unique aspects of military life, and they demand our attention and our action. Our state is home to more than 60,000 active duty military family members, not to mention veteran caregivers and survivors who we serve as well. Our commitment to addressing these challenges is reflected in our support of this legislation. This bill seeks to rename the department, adds a deputy secretary, but it emphasizes the importance of comprehensive support for military families. By enhancing the department's capacity to coordinate programs dedicated to military families, we send a resounding message that Maryland is united in welcoming those who support those who serve. This means that we have to make sure these our actions are not simply words, but actually robust support that really does make a difference for these families. So I'm here to ask for a favorable report, and I really appreciate your support in this effort.
Thank you for being with us. Next, please.
Madam Chair, Madam Vice Chair, and distinguished members of the committee, thank you for the opportunity to speak today in support of House Bill 0431. I'm originally from Maryland and for more than 2 decades traveled with my active duty Air Force spouse around the world. In 2008, our family moved back to Maryland.
Excuse me, can you give us your name, please?
Almost there. Yes,
Okay.
ma'am. I'm sorry.
Thank you.
Basing our decision on the quality of life, support services, and families. My name is Yolanda Rayford.
I should have
and-
waited. Go ahead.
And I am the chapter director for Blue Star Families for the Baltimore and Chesapeake region. As an active duty military spouse, my experience provided me with opportunities to support military families and understand the importance. This is why I'm proud to serve as a Blue Star Families Baltimore chapter. Blue Star Families is the largest and fastest growing organization dedicated to serving military and veteran connected families with nearly 275,000 members and programs reaching 1.5 million individuals every year. 5,900 of those are here in the state of Maryland. The demand for Blue Star Families chapters continues to grow, thanks in large part to our model. We are inclusive of the entire family, are embedded in communities, and intentionally work to connect military and veteran families with their civilian neighbors. This is why we are so thrilled to have Maryland, with its deep-rooted military tradition, leading the nation by also recognizing that honoring veterans and military family members means embracing and supporting these families as well. By broadening the scope to include military families in the department's name, Maryland demonstrates a groundbreaking approach to the well-being of the entire military community. Here at Blue Star Families, we ask all Americans at all levels to do their part to support military families, and in doing so, contribute to the common defense. We are so grateful to see Maryland considering this legislation and thus respond to the call to action. Thank you.
Thank you to all the families and thank you for being with us. We really appreciate it. We have actually two people that are part of the panel that are virtual. We're gonna listen to them and then we're gonna open it up for questions, okay? Will you be so kind and bring them up? Thank you. And for people that are standing, there's some seats in the front. I promise we won't bite. Good afternoon. Mr. Spiegel, will you be so kind and get started? Welcome to the Health and Government Operations Committee.
Thank you. I was having a brief computer problem. For the record, Jason Spiegel, President of the Maryland Military Coalition. We strongly support HB 431, which will rename the Department of Veterans Affairs and establish a Deputy Secretary for Military Families and Programs. Currently, Maryland is home to over 14,000 active duty spouses, over 28,000 active duty children, 11,000 National Guard and Reserve spouses, 17,000 National Guard and Reserve children, and over 6,000 survivors. Accordingly, there are a significant number of military family members in Maryland with needs that the state can help address. Renaming the department is not a symbolic act. It tangibly demonstrates Maryland's commitment to military families and developing policies and initiatives that address their concerns. We are excited about the possibility of establishing a deputy secretary whose portfolio will be focused on military family members and dependents. That way, the military families issue does not become an additional duty for the existing deputy secretary or another official. The bill ensures that a senior official reporting directly to the secretary is focused on the unique needs and challenges of military families. We are excited about the possibility of working with the new deputy secretary and believe that the creation of that position will significantly impact and improve the lives of military family members in Maryland. We strongly support HB 341, thank Delegate Pruski for his leadership on this issue, and ask for a favorable report from the committee. Thank you.
Thank you for being with us and for your service. Next, please, Mr. Arnold.
Good afternoon, Madam Chair, members of the committee. Christopher Arnold here again representing the United States Department of Defense, State Liaison Office charged with managing state government relations for the Office of the Secretary of Defense on personnel and readiness issues. Thank you for allowing me to address another important piece of legislation, House Bill 431. I just switched over from Senate Finance, where we were testifying on expanding the Maryland Military Installation Council, and that is another complementary initiative in making 2024 the year for military families in Maryland that will enable us to make every year the year of the military family in Maryland. The policies reflected in this bill are not just a structural change, they're a profound commitment to fostering healthier military communities. We perceive that the policies reflected in the bill will be emulated by other states and impact public policy across a wide range of people-centric dimensions, including the overlooked aspects of military family life, such as housing policy, food insecurity and nutrition, childcare, suicide prevention. Targeted support ensures that our families' challenges are directly addressed and not overshadowed, particularly through close collaboration between the new department and the Maryland Military Installation Council, the Department of Defense, and Maryland's military community, which will facilitate alignment, feedback, and continuous improvement. Maryland has the opportunity to lead the nation in transforming the way we care for our military families, setting the standard for others to follow, and we are grateful for the work of Governor Moore, Secretary Woods, Delegate Pruski, Mr. Spiegel, and all of his contemporaries, as well as to the members of HGO. And as liaison to the Mid-Atlantic region, I stand ready to answer any questions you may have.
Thank you for being with us today. We're now going to open it up for questions. Any questions for this panel? Seeing none, I do have a question. And that is the following, you know that we have a real budgetary constraint this session. So when I look at the fiscal note, because we can pass bill over a certain amount, it goes way beyond that amount. Because it's not just a fiscal note there, but it also on page 2 of the fiscal note, the analysis, it states MD and Maryland Veteran Administration advises that the proposed fiscal 2025 budget does not include an allocation for the new deputy secretary position, so the salary and benefits. In addition, there's the 100 and all the way to FY 29, 198, 198,000. So you're talking about, you know, a good amount when it's all said and done. Will you be so kind and work it out with the governor's office? Make sure that the money is in the supplemental budget, and make sure that we get a letter regarding that. Because otherwise it will be very difficult during this time to get it done, although we're very supportive. This committee, as you know, passes everything you bring, Secretary, and did so last session, and we're very supportive of our families. But those are the rules that we were told, and if you can, you know, the governor proposes the budget, if you can find the funds, we will be so grateful, okay?
Thank you, Chair Peña-Melnick.
My
We'll follow
pleasure.
up.
My pleasure. And that actually, let's see, is there anyone else? We do have Rachel London. Will you be so kind? Thank you so much for being with us today. Thank you. How are you, Miss London?
I am well, thank you very much. Madam Chair, Madam Vice Chair, members of the committee, I am Rachel London, the Executive Director of the Maryland Developmental Disabilities Council. We are here in strong support, and I want to thank Secretary Woods for his commitment to military-connected families, particularly those who are caring for children and adults with developmental disabilities. So you may not expect me to see me here during this kind of bill hearing, and certainly you'll see me at others. But you've heard why this change is important to military families, and you've heard about their unique needs. Now, think about if you're also caring for a child or adult with developmental disabilities and their unique needs. We know a variety of things. Maybe we don't know how many families have children and adults with developmental disabilities, but we can make a pretty educated guess that there are thousands and thousands. We know that children who are have a parent, at least one parent who is deployed, are at risk for developing delays and developmental disabilities. And we know that the sooner and more often that families get the information, resources, and supports and services they need, the more they will thrive in Maryland. So that led us, the Developmental Disabilities Council, to partner with Secretary Woods and the department in a formal MOU to learn from military families about what they need, what information and resources, what is or is not available, and how we can target that information and resources about services and supports for children and adults with developmental disabilities. For an example, we've already learned and gotten feedback that both a welcome kit for families when they transfer to Maryland would be helpful, as well as an information kit for when families transition out of military service. So again, we are in strong support, and I want to thank you and Secretary Woods and the department for their continued commitment to military families, particularly those who are caring for people with disabilities.
And I want to thank you for all you do over the years for the, disability community and your advocacy. It really has made a difference. Are there any questions for this witness? Seeing none, thank you for being with us. And for the virtual witnesses, thank you so much for making the time to come in front of us, okay? You have a great day. Have a blessed day. Bye-bye.
Thank you.
So this actually concludes the bill hearing on House Bill 431. And now we have House Bill 380, Delegate Solomon, State Emergency Medical Service Board, Licenses and Certificates Application Requirements. Delegate Solomon, will you be so kind and bring your panel? You're welcome.
Good afternoon, colleagues. I don't get to spend enough time in HGO, so thank you for the opportunity to present this bill. For the record, my name is Delegate Jared Solomon, District 18, and I'm really proud today to present House Bill 380. And I just want to first off say that this bill builds off of the brilliance of all of you. So this bill is modeled essentially off the health occupations bill that you passed last year that I know the chair was a champion of for a very long time. And thank you to Delegate Lopez for her work and leadership on that. And so what this bill does is essentially apply that same framework where we remove the requirement for a social security number or an ITIN number or any proof of lawfully present status in order to get a license. And the reason why we need this bill is because MIMS and the requirement for emergency medical technicians is covered under a different article in state code. It's covered under the education article. So it was not covered under health occupations. But more than just what the bill does, it will help our communities in so many different ways. So I wanted to share just a couple of statistics, and you're going to hear from the Hospitals Association. You're going to hear from Dr. Delbridge from MIMS, and I have to thank MIMS profusely. They worked with us hand in glove throughout the summer and the fall to get this bill together. But some of the stats, 45 communities lost their ambulance provider in the last 2 years based on staffing shortages. In Baltimore City, there's over 25% of the emergency medical service positions are unfilled. And we have wait times across the state as high as 60 to 90 minutes to get crews to transport patients to hospitals. So this bill is about fairness on so many different levels and supporting our communities in so many different ways. And, this was highlighted in the recent commission that came out to advance and strengthen firefighting and emergency medical services within Maryland. The way that we came to this, and you're going to hear from Madeline shortly. So she is a volunteer at the Wheaton Rescue Squad, which is in my district, and I know also serves the great vice chair's district as well in our community. And you'll hear her incredible story, but she became an EMT to give back to her community, to help care for folks in need and in critical shortage, to help care for her community, and help people in their time of need. And what she discovered was when she wanted to advance in her work, and again, this is an unpaid position, it's the Wheaton Volunteer Rescue Squad. She does this out of the goodness of her heart to give back to the community. When she wanted to advance to become a supervisor and essentially lead a squad of folks in Wheaton, she was told she couldn't because she couldn't get her license, not because she wasn't qualified, not because she hadn't completed extensive training and educational coursework. It was simply because she didn't have a social security number. And so when I heard that story and I saw the great work that your committee did last year, there was really no question, again, working with MIMS, that we were going to put this bill forward and allow Madeline, and so many of her colleagues across the state to be able to serve their communities as well. The last point that I want to make before I turn it over to the panel is there's nothing in this bill that will change the actual requirements to get the license. Literally, the only thing it is doing is removing the Social Security and the ITIN requirement. The licensure requirements, the educational requirements, which are quite large to get the certification, they all stay in place. Again, this is modeled off of what you all did with the health occupation licenses, where all of those stay the same. It is just that one component that the federal government actually gives states flexibility to say, if you want to choose to run your systems a little bit differently, we're not going to stand in the way, but you have to legislate that. So with that, I would ask for a favorable report. Really appreciate the committee's time and consideration on this, and I'm going to turn it over to our panel.
Who would you like to go next?
Want to go?
Like to go next. Hello, my name is Madeline Perez Cruz, and I stand before you today in support of HB 380, the EMS bill. The United States has been my home since I was 5 years old, and I am a nationally registered EMT who has served as a rescuer in Maryland. until the state law and current red tape prevented me and others like me from serving our community. I have been a member of Wheaton Volunteer Rescue Squad for 5 years, and my desire to serve was actually sparked by personal experience. When I was 8 years old, my mother suffered a severe fall, which caused a brain bleed and then caused a coma. The professionalism, the kindness, and the reassurance of the EMTs that day left a long-lasting impression on me. Inspired, I trained for years to become an EMT and began responding to emergency calls. I treated each patient and their families with the respect and the dignity that they deserved. However, due to my immigration status, I am currently barred from obtaining my Maryland EMT license, despite completing all of the requirements and being able to serve in other states. HB 380 proposes a solution. It allows qualified individuals like myself to contribute to our state's emergency response system. It's not about individual exemptions. It's about expanding the qualified pool of EMS providers in Maryland. We face a growing demand for emergency medical services, and every trained responder represents a life saved. HB 380 doesn't lower standards. It leverages the skills and the dedication of individuals who have already chosen to serve their communities. The countless families who rely on timely and effective medical intervention during emergencies will also be benefited by this. This bill ensures that we have an access to a broader network of qualified professionals that are prepared to respond with compassion and expertise. The bill will strengthen Maryland's emergency response system by embracing qualified individuals like myself, and we can build a more effective safety net for all of our residents. Thank you.
And thank you for your service. We really appreciate it. Thank you for being with us. Who's next, please?
Okay.
Go ahead.
Good afternoon, Madam Chair, members of the committee. I'm Dr. Ted Delbridge. I'm the Executive Director for the Maryland Institute for Emergency Medical Services Systems, or MEMS, and I'm also here on behalf of the State EMS Board. The State EMS Board asks for Social Security numbers amongst applicants for certification or licensure only to be in compliance with Section 1621 of Title 8 of the United States Code, which prohibits anyone who is not a qualified alien or non-immigrant from obtaining a public benefit. And it defines a public benefit to include a professional license provided by an agency of the state. However, Section 1621 also provides a stipulation that allows the state to make an individual who is not lawfully present in the United States eligible for a public benefit that they would otherwise be ineligible for through enactment of a state law affirmatively providing for such eligibility. The legislator previously solved this problem for other health occupations last year. We ask that you do it again for EMS clinicians. We request a favorable report for House Bill 380. It makes common sense. Thanks.
Thank you. Thank you for being here. Next, please.
Thank you. Gam Wijaytunga. I'm a firefighter and paramedic and past president of the Wheaton Volunteer Rescue Squad. Last year in Wheaton, volunteer and career EMTs, paramedics, and firefighters responded to over 10,000 911 calls for service. Our 100 plus volunteers provided nearly 80,000 hours of service while responding to fires, car crashes, assaults, cardiac arrests, overdoses, births, and yes, the occasional cat stuck in a tree. It's dangerous work. We get sick and injured both physically and mentally, and the work places enormous strain on our families. No matter how difficult the burden, the 911 calls keep coming, and we simply can't let our communities down. Keeping our ambulances and trucks staffed is a matter of life and death. Every volunteer that gets certified and licensed by the Maryland EMS Board fills a critical position in the field. House Bill 380 and its companion will allow us to immediately increase our staffing by one person, Maddie, and more in the future. Amending Maryland law seems an extreme length to go to put just one more EMT on an ambulance in Wheaton, but it reflects the absolute urgency of our need. Again, the 911 calls don't stop coming just because red tape is standing in the way. I applaud you for working together to remove this barrier. You'll help people in Wheaton and throughout the state of Maryland. Thank you.
And thank you for being with us. We really appreciate it. Next, you have 4 people. There's someone else. There's a 5th. Yes. Thank you. Mr. Kaufman, how are you?
Good. Thank you very much. Thanks for the time.
You're welcome.
I'm speaking today as president of the Wheaton Volunteer Rescue Squad and on behalf of one of our members, Natalie Perez Cruz. Natalie joined the squad in 2019 when she was 16 years old. Since then, she has completed high school and has earned an associate degree from Montgomery College. She has completed the University of Maryland's Emergency Medical Technician and Firefighter training at the Montgomery County Public Service Training Academy. The Maryland Institute for Emergency Medical Services Systems, the licensing agency for EMTs, will not issue a license as she is in the United States illegally, does not have a social security number, and has no work permit. Natalie arrived from El Salvador with her family in 2008 when she was 5 years old. She had no idea of her immigration status until MIMS denied her EMT license. She has sought assistance from multiple agencies and attorneys. She's not eligible for DACA as she arrived after June 15th, 2007. She's been advised that to become a legal immigrant, she should return to El Salvador for a year where she has no family anymore, and then have a legal relative sponsor her return to the United States. I've had the pleasure of knowing Natalie since 2019 as we are on the same duty shift. She is pleasant, helpful, always on time, dressed in uniform, and participates in all activities. Although she's not an EMT, she is able to provide emergency patient care under the supervision of a licensed EMT. She assists in training our new members and has proven to be an excellent clinician. Please find a path for Natalie, who has proven her ability to function and serve as a productive citizen of our community, a means to obtain her Maryland EMT license and continue to serve the citizens of Maryland. Thank you.
And thank you for being here with us. We really appreciate it. I'm going to open it up now for questions from the committee. I have Delegate Woods, followed by Delegate Kaiser. Oh, was she first? Okay, I need to look to the right. Delegate Kaiser, followed by Delegate Woods. Thank you for being fair. Go ahead.
Thank you, Madam Chair. Thank you, Delegate Woods. I wanted to ask a question of the EMT gentleman in the front row. I heard you reference saving cats up on trees, and I have to tell you, when I'm driving with my 4.5-year-old, we discuss, well, where could that ambulance be going? And she says, well, maybe it's getting a cat out of a tree. So be honest. How often does that actually happen in a year?
Well, I don't have the stats on it, but at the rescue squad, we do have what's called a heavy rescue squad staffed by firefighter EMTs. Maddie is actually a firefighter as well, so we're getting her on that truck. I've been doing it 27 years as a volunteer now. I've probably done it 3 times. So it does happen. And hopefully that cat's calm, because it can be kind of nervous getting up there.
Thank you. I like the question. Delegate Woods,
Thank
followed
you.
by Delegate Olston.
Thank you, Madam Chair, and thank you, Delegate Kaiser, because my question is going to be a kind of up in the air question, and I apologize to you, Madam Chair, because it's really coming more out of my frustration. First, I want to thank you, Maddie, for what you have done, for your volunteer and your service. And I'm so frustrated by the fact that we have people with ITN numbers who can't get a work permit, but are permitted to work. That's a problem. And then I'm frustrated because things like you can own property, but you have to pay 3 times as much to get, to buy a house because you don't have a social security number. My question is, and it's probably a question that I'm throwing in the air, what in the world are we going to do to prevent this from being a barrier for people who are in this country doing the work, making themselves, paying taxes, doing all of the things that we require, but because we won't give you a social security number, Bonnie, that, what in the world are we doing to get rid of this requirement for a social security card in place of that ITN, or in addition to the ITN? Thank you, Madam Chair.
My pleasure.
In question.
Well, and I will say, even in this instance, thank you for the question. This isn't even about being paid, right? This is so that she can get the certification to continue to volunteer to serve her community.
And if I may, it's really, immigration is a federal issue. And what happens is, because the federal government is not like HGO, where we work together, is not getting it done, no offense to anyone, the states are really facing these issues that are really bread and butter issues, right? And are a matter of surviving, right? So this is the reason why so many other states have allowed it. We're not the first or the second or the third. because it's a solution, right? Delegate Olston. What happened?
Yeah, something got stuck in my throat, actually. I just wanted to thank Maddie for your service. And did I hear correct that you're still a firefighter as well?
Yes, but for Montgomery County, I have to be an EMT before I can actually also work as a firefighter. Again, finished all the requirements. I just need that licensing.
Thank you. Madam Chair, it would be good, I think, if we could look at all of the areas where our fellow citizens are being prohibited from work because of this type of issue. Even though it is a federal issue, anything we can do at the state level to help alleviate some of these burdens and help improve our workforce, I think is something we should look into.
Yeah, so what happens is that it depends on the subject matter. Like this comes here, but a lot of the other like occupational licenses go to economic matters. And
yeah,
so let's talk offline.
Yeah, well, I wanted to say it while I thought about it.
No,
Thank you for your service.
I think it's a good point. Thank you. We have next Delegate Hutchinson.
Thank you, Madam Chair. Maddie, thanks for being here. Many moons ago, I was a volunteer fireman and also served on our rescue squad. That was in the days when jump seats were open air and you were still allowed to hang on the back of the fire truck to get to the fire. So I'm aging myself there. But to the gentleman at the end from MIMS, even in my days, I was able to be trained to be an EMT. I never quite got the certification. Is Maddie able to at least go through the program, or you need to have the Social Security even before you can get into the program?
No, Maddie's gone through the program and she's actually completed national registry. So she qualifies in every aspect to be an EMT in Maryland, except for the stipulation that she can prove legal immigration status.
You're welcome. So I don't see any other questions. I want to say, what did it take for you to become a paramedic? Can you tell the committee like the coursework?
To become an EMT, well, firstly, at our station, you come in and you finish a level 1 packet, which is just the basics of what has to be done or what should be known on the ambulance. Then you sign up for an EMT course, which is a 6-month course. After the EMT course, you take a PEEF course. That's I think a weekend course, and then a hazmat course, which took me about another 4 weeks. And then our in-station training, which can take about another 6 months, which just is more checkoffs from other trained personnels, making sure that we're doing the work to the level that is expected of us.
And then firefighter.
And then for my firefighting course, I took I think it's 3 months of firefighter 1, then another 3 months of firefighter 2. And then after that, it's expected another 6 months of squad training to be able to ride the rescue squad.
And that's all for free.
Yes.
You know, in full disclosure, my son is a volunteer firefighter and paramedic, and he has both licenses, and he just got an award for top caller. And it's all for free. And he does it on Saturdays and Sundays.
Yes.
Saturdays and Sundays. And I'm going to embarrass him. Maybe this is why he doesn't have a girlfriend.
Nothing to do with our bill.
Saturdays and Sundays, and I go, honey, it's the weekend. He's like, mommy, I like it, I enjoy it, but he is so committed, and he took all those courses and tests, and for the hazmat class, he had to drive from College Park for 4 weeks all the way to Frederick, where they teach it as well. So I want to thank you for your dedication and for making a difference. Okay, I hope you feel the support here, all right, for your dedication to what you're doing. Thank you so much. And thank you all for the service, okay? And
Thank you.
actually, this concludes the bill hearing on House Bill 380. You have a blessed day. Now we are going to call Delegate Rosenberg. We changed it a little. House Bill 425, Advanced Practice Registered Nurse Compact. Will you please bring your... Yes, absolutely. 1 second. And that will be, 1 minute. It will be Peggy Townsend, Robin Elliott, Rachel Sherman, Nicole Livanos, and Mitzi Fishman. Will you be so kind and come up, please? And if you don't have enough chairs, just pull one up. Thank you for being flexible. Just come up. And Delegate, will you be so kind and get started?
Thank you, Madam Chair.
You're welcome.
I'm here on House Bill 425, Advanced Practice Registered Nurse Compact. This is identical to the bill we passed last year. Out of this committee unanimously and passed the House 112 to 21. I feel with the people sitting next to me like I've been named to the All-Star team.
They are great people.
Thank you. That's because this is a bill of great significance to both advanced practice nurses and to the citizens of this state and the other states that they would be able, for whom they would be able to provide care with the passage of this bill. Most recently, the report of the Healthcare Commission stated that interstate compacts such as the one that is at issue here improve consumer access to providers for that very point that I just made, that our best nurses in the current medical environment and in the current shortage of nursing care, it's a two-way street. Nurses can provide care here and in other states, and nurses who principally practice in other states can provide care here. This is a particular benefit to nurses in military families. Even though this bill doesn't have a title of the military like some of the bills we've heard earlier today, a spouse who is a nurse and travels with the military spouse, this kind of compact facilitates their being able to provide their professional care in whatever jurisdiction, provided the jurisdiction participates in the compact. So for those reasons, I would again urge this committee to give a favorable report to this legislation and request a favorable report. Thank you.
You're welcome. And who will be next?
I'm Robin Elliott. Thank you for the compliment, Delegate Rosenberg. I don't think you'd want to see me play baseball, but I certainly can talk about the APRN Compact. I'm here today on behalf of the Maryland Nurses Association and the Maryland affiliate of the American College of Nurse Midwives. And the Nursing Compact for RNs has been around for a very long time. And actually, Maryland was the first state to join it in 1999. I've been representing the Maryland Nurses Association since 2006. It's a long time. And I've only ever heard positive things about the Nursing Compact. The APRN Compact is built in essentially the same way. It is extremely similar to compacts that you all have passed involving psychologists, professional counselors, speech pathologists, occupational therapists, and physical therapists. You have another compact before you just last week, I think it was. They're all essentially the same. We are in desperate need of an APRN compact because those nurse practitioners, those nurse midwives, those clinical nurse specialists, the nurse anesthetists, they are all the core of the healthcare that most of us get every single day. And so with that, we know their shortages and we ask this committee for a favorable report. Thank you.
Thank you, Robin. Next, please.
Thank you, Madam Chairman. Peggy Townsend on behalf of the Hospital Association. We too are in strong support of this bill. As this committee knows full well, we have shortages, workforce shortages in Maryland, including physician shortages, primarily in anesthesia, primary care, and psychiatry. To fill those gaps, hospitals often rely on the individuals Robin just outlined, the advanced practice nurses, to ensure we have access to care for the people that come through our doors. During the pandemic, you know, the state loosened the requirements and we were able to recruit individuals from out of state as long as they had a license in good standing in that state. And it worked very, very well. But once the compact, once the pandemic left, the authority to do that. As a result, the department entered into reciprocity agreements with DC and Virginia. Unfortunately, the reciprocity agreements that are working quite well don't include APRNs. It did not include them. So those nurses have to wait the very long time it takes to get a license from the Board of Nursing. So they aren't subject or covered under reciprocity. The Board of Nursing, as you know, has been troubled in the past, and this would alleviate some of their paperwork and backlog. And the last thing I will add is Delaware just passed this. So it is coming to Maryland, and we have hospitals on that border that would be able to take advantage once the compact came into existence. So for those reasons, we have urged a favorable report.
Thank you, Peggy, and great to see you there. Next, please.
Chair Peña-Melnick, members of the committee, my name is Nicole Ivanos. I'm the Director of State Affairs for the National Council of State Boards of Nursing. The bill before you today is familiar, not only because it passed the House, but as Robin mentioned and Delegate Rosenberg, this compact is modeled after the Nurse Licensure Compact. So like the Nurse Licensure Compact, the compact allows for an APRN to hold one license and have the ability to practice both in person and increasingly importantly so electronically across state lines. APRN practice under this compact should also look familiar, as Maryland's scope of practice laws will continue to govern any advanced practice nursing services that patients within the state of Maryland will receive. Patients will continue to have access to safe and quality APRN care. And the need for the compact is there. Healthcare leaders across Maryland are supporting the bill to strengthen Maryland's healthcare workforce, to reduce the time it takes for Maryland patients to access care, to close provider shortage gaps in primary and mental health and women's healthcare services, and to support a more modern mobile workforce. Healthcare leaders in Delaware and across all 4 states that have enacted the compact thus far support the compact for similar reasons. The APRN compact is also supported by APRNs in Maryland. The 2022 survey found that 45% of APRNs in Maryland hold more than one APRN compact or APRN license today. Maryland APRN should have the choice to elect a voluntary multi-state license to alleviate financial and regulatory burdens of maintaining multiple licenses. 83% of APRN respondents said that they would apply for a multi-state license if given the option. We believe they should have that option. Thank you for the opportunity. I urge support.
Thank you for being with us. Next, please.
I can scoot up here. All right. Good afternoon, Madam Chair, Vice Chair, and committee members. My name is Rachel Sherman, and I have over 10 years of nursing experience. I've practiced across a wide variety of settings as a nurse practitioner, and I'm currently licensed as a family nurse practitioner in Maryland, Washington, D.C., Virginia, and soon Delaware. I'm a member of the Maryland Academy of Advanced Practice Clinicians, or MAPC. I was also recently appointed as an advanced practice member to the Board of Nursing. And I'm here today in support of House Bill 425 and appreciate the opportunity to provide testimony. House Bill 425 provides or positions Maryland ahead of the next healthcare crisis. As demonstrated through the COVID-19 pandemic, critical shortages of healthcare providers can have devastating implications across the various communities that you represent. This bill will support the healthcare workforce should the need arise to recruit and employ advanced practice registered nurses. This bill also aids military families experiencing relocation. House Bill 425 will help to reduce the financial burden experienced due to having multiple state licenses. And I can tell you, as a nurse practitioner having multiple licenses, I can pay upwards of $1,000 per state in renewal fees. Passing this bill will make Maryland more attractive to advanced practice registered nurses who desire to live in and or work and practice in the state of Maryland, further strengthening our workforce. House Bill 425 will support patients who seek medical care in Maryland but live in another state. With the expansion of telehealth services, this bill will increase access to continuity of care and promote improved health outcomes. Thank you for your opportunity to provide testimony, and I ask for a favorable report.
Thank you for being with us today. Next, please.
Good afternoon, Madam Chair, Vice Chair, and committee members. My name is Mitzi Fishman, representing the Board of Nursing, and we are in support of House Bill 425. So just like last year, the board believes that the compact will help to improve the nursing workforce shortage in the state by supporting the portability of APRN licensure. In addition, just based on the survey that was conducted by NCSBN and the board in 2022, about 94% of respondents, which included both RNs and APRNs, were in favor of the compact in the state. And then lastly, we believe that the compact will help to improve the operational workflow at the board by alleviating the burden of processing endorsement applications. As a result, we'd be able to free up staff resources and redistribute staff responsibilities, such as focusing more on our in-state applications. And with that, we do hope for a favorable report. Thank you so much for your time.
Thank you for being with us today. So we're going to open it up now. Everyone has testified, right? We're going to open it up for questions. After this panel, I'm going to call an unfavorable panel just to be balanced, right? So are there any questions for this panel? Delegate Morgan, followed by Vice Chair Collison.
Thank you, Madam Chair. Question for Robin. You were talking about the advanced practicing registered nurse compact, but that's not the same as like registered nurses. Is this the same or is it different?
It's an additional compact. So there is a registered nurse compact. That's called the Nurse Licensure Compact. And that's the one that's been in effect. Maryland adopted it in 1999. But advanced practice nurses are practitioners who have an RN and then additional graduate level education. There are 4 types of advanced practice registered nurses. You probably hear most often about nurse practitioners, nurse midwives, but they're also clinical nurse specialists and certified nurse anesthetists.
Correct?
Correct.
Okay. Thank you for clarification. Thank you, Madam Chair.
My pleasure. We have next Vice Chair Collison, followed by Delegate Johnson.
Thank you, Madam Chair, and thank you for this bill. I think this is a question for Ms. Lavanos. Is that right? You know a lot about the compact, and we've heard concerns from those who are opposed to the bill that they are worried about the practice hour requirement in the compact. Can you tell us how that works?
Thank you, Delegate Collison, for the question. Nicole Ivanos from NCSBN. So I think to explain the 2080-hour requirement first, let's talk about what it isn't. It's not a requirement that APRNs must meet in order to practice to their full scope of practice. It's not a requirement they must meet in order to be licensed in the state of Maryland. It's an experience requirement that they must meet in order to add the multi-state licensure privilege to their license. Again, it's a voluntary license. And also importantly to the 2080 hours, it is not an additional requirement. And so right now, about 90% of licensees across Maryland would meet this requirement on day 1. So it's not an additional 2080 hours. It's simply an attestation that you have practiced for 2080 hours, which is about equivalent to 1 year.
Oh, absolutely. I just want to confirm, it is experiential hours, not educational professional development hours. You've experienced 80 to 100 hours.
So not only is it just experience requirement, it's not supervised experience requirements. Maryland has fought hard to remove barriers to APRN practice and remove some of those collaborative or supervisory requirements in previous years. This 2080 hours is simply experience as an APRN in Maryland or in any other jurisdiction.
Thank you.
Thank you.
We have Delegate Johnson, followed by Delegate Hutchinson.
Thank you, Madam Chair, and thank you for the bill and coming today to present it. My question has to do with public safety. And we've heard different compacts handle complaints a little differently. So I'm reading here that the health and safety of the public are affected by the degree of compliance with the APR and licensure requirements and the effectiveness of enforcement activities related to the state APRN license laws. So can you explain to us, if there was a complaint by a Maryland citizen on someone out of state, how that complaint would be handled?
Absolutely. Thank you for that question. So just like the nurse licensure compact, the APRN compact disciplinary provisions look identical. And that is that each state board of nursing still maintains control over enforcement of their nurse practice laws and their nurse practice act within the state. And so if there is a patient within Maryland who is harmed by a provider or wants to file a complaint, they're not filing it with a national commission. They're filing it with the Maryland Board of Nursing. That process remains the same, as well as the multitude of options in which, enforcement authority that the board has. So they could decide at the end of the day to suspend the license, to revoke the license, et cetera. It's the same menu of options to ensure that the board is functioning the exact same way as they would be today if a practitioner or if a complaint was filed with the Board of Nursing.
Yes.
It was a Maryland citizen filed a complaint against an out-of-state doctor. The Maryland board would have the authority to revoke the license to practice in Maryland. Is that what you're telling us?
So yes, they would have authority to revoke the privilege to practice in the state of Maryland. Yep.
You're welcome. Delegate Hutchinson, followed by Delegate Kaiser.
Thank you, Madam Chair. Maybe for the delegate, but anybody that can answer it. I think I looked back at my notes from last year when this bill came up, and you may have already answered this, but I may have not heard this. Last year, you needed 7 states for this to go into effect, and last year there were 3 already. Is that still the case, and how many are there today?
I'm happy to answer. Yeah, I'm happy to answer that. So just yesterday, South Dakota enacted the APRN compact. So we are at 4 states, 4 jurisdictions. There are 2 additional pending legislation, of course, the one before you today, as well as in Arizona, which is also having a hearing right now as we speak on the APRN compact. Last year, there were 7 states that introduced the compact. And so we're very encouraged by the number of states that have expressed interest in the compact. We know that it's needed. And I think that that demonstrates that. Thank you.
Delegate Kaiser, followed by Delegate Whitehouse.
Thank you, Madam Chair. I'm not sure if I missed this at the beginning. I know this passed unanimously in our committee and pretty strongly on the House floor last year. What are the differences? And again, maybe you address that. And what were the, why didn't it go through the Senate? What were the reactions there? And have there been changes to address some of those concerns? Thank you.
Who's the best individual to answer this question?
I'm happy to answer this question. So there are 80,000 nurses in Maryland, and I'm forgetting right now the number of APRNs, but there is a diversity of opinion. Most of the groups involved with advanced practice nursing are supporting the bill, but I know there is one that is not. You will hear from them. This is just a difference of opinion, and that's why it's before you all to make those decisions.
Thank you. Delegate Whitehouse.
Thank you, Madam Chair, and thank you all for being here today and sharing with us. We've been able to receive and hear about other compacts, and just help me understand how this would also operate and some of the other compacts that we've had the opportunity to hear about. As an earlier adopter, our state would have an opportunity to have a seat at the table, right? To be able to inform the various policies and procedures by which the compact could potentially operate, of course, under the guidance within our state laws, of course. But in this particular instance, and given where we are with other states in the landscape that you just described, would it be able to, would it provide us with the opportunity to have a seat at the table and to, if anything, work through some of the issues that some that others have elevated in their testimony with these concerns that were raised by those in opposition? So could anyone speak to that, or how would some of their concerns essentially be addressed?
Sure. I'm happy to take that. Thank you so much for the question. So You're absolutely correct that when the compact hits 7 states, the commission will be formed. And the commission is the quasi-governmental agency that regulates the compact and only the operations of the actual compact. So if Maryland were to be one of the first 7 states, it would be participating in the discussions around adopting bylaws, adopting rulemaking to help clarify provisions in the compact and make sure that it gets operational, up and running, and that mobile practice is realized for APRNs. So to answer your question about, what could be changed or what powers does the commission have? So they have powers that are limited just to the operations of the compact. Certainly they can help to clarify and help to set up operations that can make things run smoothly. The tenets of the compact will remain the same. However, within this bill, there is language that says that the Maryland Board of Nursing and the Maryland, the head of the state licensing board or their designee is going to be the Maryland member on that commission. Right within our language, we did add language that was supported by the Board of Nursing to say that they will recommend what would be called an APRN advisory committee, a committee made up of APRNs who sit on regulatory boards. So they are regulatory, well-versed in regulation, and they would provide comment and provide feedback and advise the commission of its work. Thank you.
Thank you. You're welcome. Any other questions? Yes, Delegate Gazzoni.
Thank you, Madam Chair.
You're welcome.
Really quickly, because I think that you said that, just I want to confirm, participation by any individual APRN in this compact would be voluntary?
Yes.
Thank you very much.
Thank you. Any other questions? Seeing none, I do have a question for the Board of Nursing. Will you be so kind? As you know, we are in a budgetary constraint this year. And as always, we try to be balanced and reasonable. The fiscal note states that the expense will be at least at front, at least $150,000, and it will come from the Board of Nursing money. And then in the future years, there's some type of expense. So are you able to do that with existing resources? Tell us about that.
Yes, so I'm speaking with our IT department as well as the senior leadership at the board. We are in agreement with that $150K fiscal impact, and we're in agreement with that.
All right, can you try to work on that fiscal note to bring it a little lower? Okay, and make
Absolutely.
sure that the committee gets a letter. Okay,
Absolutely, we'll get back to you.
thank
after
you
the
very
hearing.
much,
Thank
because
you
it's
so
a little
much.
higher than what we're allowed to pass. Okay,
Thank you so much.
thank you. And I think I don't see any other questions. So I just want to thank you for your service to the state and thank you for your testimony today. And I hope you have a blessed day. Now I am going to call an unfavorable panel and it will be as follow. And when I call your name, will you please come up? And also, if there aren't enough chairs, bring up some chairs, okay? First, I have Sarah Peters, then Deborah Brocado, Lindsay Ward, Kathy Ware, Janet Selway, Claire Bode, and Daniel Shudock. Will you please come up? So I call 7 people, so I should see 7 chairs. Okay. And who will get started? Will you be so kind and start, please?
I'll go ahead and get started. I'm Deborah Brocado with Maryland Right to Life. And on behalf of our 200,000 followers across the state, we do respectfully object to House Bill 425. The 2022 session of the Maryland General Assembly significantly lowered the standard of care for women and girls with the Abortion Care Access Act by removing the physician requirement for medical and surgical abortions. This bill further erodes the standard of medical care for all women and girls by allowing nurses to prescribe medications across state lines.
Having more people available to prescribe or more people providing healthcare does not necessarily equate to better medical care. You have my written testimony along with the article from the National Institute of Health describing the adverse events from the abortion pill. In December of 2021, the FDA permitted the remote sale of chemical abortion pills and no longer required a physician's examination. So this legislation would make it too easy to omit a crucial part of patient care, and that is the in-person physical exam. Women and girls deserve that layer of safety to confirm or deny a pregnancy, but also to assess for any other condition that may be present. There are contraindications for the abortion drugs that can only be determined by an in-person exam and other testing. So let's take care of the women and girls of Maryland and let women and girls in Maryland deserve the best standard of medical care. And this bill lowers that standard. So for these reasons, we do respectfully ask you to give an unfavorable report for House Bill 425.
Thank you, Ms. Mercado, for your testimony today. We appreciate it. Next, please. Please don't touch the lights. I know you feel like it, but
Sorry.
it's okay. It doesn't need to be touched.
I'm sorry.
It's a little fickle.
Sorry about that.
Touch it. Thank you.
Madam Chair and Vice Chair and members of the committee, thank you for your time today. My name is Claire Bodie. I'm an assistant professor in the Family Nurse Practitioner program at the University of Maryland School of Nursing, and I practice as a nurse practitioner 1 day a week. In addition, I'm the chair of the Legislative Committee for the Nurse Practitioner Association in Maryland. While we fully support the concept of an advanced practice registered nurse compact, this legislation is deeply flawed. There are at least 6 problems with this bill that cannot be changed. One problem is the current bill will increase the administrative burden on the Maryland Board of Nursing, which is already overwhelmed by administrative tasks, which leaves countless nurse practitioners in our state frustrated, unable to provide care, and hopeless trying to navigate the red tape. Under this compact, the Maryland Board of Nursing would be responsible for tracking Maryland advanced practice registered nurses to ensure they are eligible to enter into this compact. In the 2023 fiscal year report, the Maryland Board of Nursing has received 1,210 new complaints against licensees. At the end of fiscal year 2023, this now totals 6,269 cases. Licensees who are under investigation are often unable to work and remain in limbo, often for years, until the complaint is resolved. This keeps the healthcare workers out of the workforce, ultimately denying Maryland residents access to health care. Under this compact, a complaint against an advanced practice registered nurse compact licensee returns to the home state, which then requires the Maryland Board of Nursing to keep track of their of those activities. This is placing more licensing and investigative requirements on the Board of Nursing. I ask that you vote unfavorable on House Bill 425. Thank you for your consideration.
And thank you for your testimony today.
And I apologize for going over.
You know what? It's okay. It wasn't much. Thank you. Next, please.
Good afternoon, Madam Chair, Vice Chair, and members of the committee. Thank you for the opportunity to speak today. My name is Lindsay Ward, and I am a pediatric nurse practitioner living and practicing in Anne Arundel County. I am testifying today as the president of the Maryland chapter of the National Association of Pediatric Nurse Practitioners in opposition to House Bill 425. This version of the APRN compact does not address prescribing controlled medications across state lines. Some states allow APRNs to prescribe medications independently. Some require a collaborative relationship with a physician, and some states do not allow APRNs to prescribe certain medications at all, including ADHD medicines. In Maryland, we have full practice authority, meaning we can practice and prescribe autonomously without physician supervision or a collaborative agreement. I have several patients attending college out of state that I manage their chronic and mental health issues, including ADHD. If this version of the compact is adopted, I would be able to see them across state lines, but I may not be able to treat them for certain issues, including ADHD, as this medicine is considered a controlled substance. APRNs prescribe these medications daily. If I cannot prescribe the treatment my patient needs, the patient will bear the burden of finding a new provider across their state that will take their insurance, accept them as a new patient, and continue their care. This disrupts the continuity of care that we have established during a significant transitional time of a young adult's life. A well-developed compact that addresses prescribing all medications across state lines is essential. As previously mentioned, this legislation cannot be amended. If it could, we would be the first to offer amendments. Instead, we're forced to accept or reject. For those reasons, we remain confident that the NCSBN will hear our concerns and welcome us to the table to introduce a compact next session that fits the needs of all APRNs and those we care for. I respectfully request an unfavorable report.
Thank you, and thank you for your service. Who's next?
Thank you. Good afternoon, Madam Chair, Vice Chair, and members of the committee. I'm Dr. Janet Selway, a nurse practitioner and a past president of the Nurse Practitioner Association of Maryland, also known as NPAM. I'm an associate professor at the University of Maryland School of Nursing in Baltimore, and I direct the Adult Gerontology Nurse Practitioner Doctoral Program in Primary Care. I'm speaking today on behalf of NPAM. We request an unfavorable report on House Bill 425. Yes, we definitely need improved licensure portability for advanced practice RNs. However, this is now the third attempt to create an APRN compact, and unfortunately, it still misses the mark. The requirement for new nurse practitioners to practice for 2,080 hours in the home state before they can apply for multi-state APRN license is a problem. This practice requirement differs from Maryland's requirements since 2015 for new nurse practitioners to have a mentor for 18 months from the date of application for state certification. The mentor requirement does not specify hours to be tracked. Rather, it specifies a time interval, and it doesn't delay workforce entry anywhere for new nurse practitioners. The practice hour requirement sends a message that new nurse practitioners are not ready to practice upon graduation. This is simply not true. The RN, the nurse licensure compact has no similar practice hour requirement. This requirement for 2,080 hours is not grounded in any evidence for need. Requiring post-graduation practice hours presents challenges to states working to retire similar practice barriers to improve access to care. This is one reason why 6 national nursing organizations are on record as opposing this version of a compact. The compact has problematic language that party states cannot quickly amend. What is the solution? Rewrite the compact to allow APRNs to practice at the top of their license, or perhaps license reciprocity is a simpler solution and should be considered. Thank you for your time, and NPAM requests an unfavorable report for House Bill 425.
Next, please, and thank you for your practice.
Good afternoon, Madam Chair, Vice Chair, members of the committee. My name is Kathy Ware. I'm an adult nurse practitioner living in Anne Arundel County, and I'm speaking today in opposition for House Bill 425. As a nurse practitioner, I am well aware of the nursing workforce shortages in Maryland. This bill in its current form is not a strategy to solve that problem. The bill language is flawed in many ways, including that it does not have APRN representation on the Interstate Commission, which oversees administration of the compact, including rulemaking and judicial matters for member states. Here we have a compact for advanced practice registered nurses, but no seat at the table for advanced practice registered nurses. It is essential that APRNs be included in an administrative commission. Otherwise, decision makers without firsthand knowledge or experience are making decisions for us. The inclusion of members
of all professions on a body governing their work is crucial to achieving excellence and ensuring public safety. To put this into perspective, exclusion of APRNs on the Interstate Commission would be akin to the Maryland State Bar Association Board of Governors, not including lawyers. A well-constructed compact could enhance license uniformity and portability across state lines to increase the APRN workforce and therefore improve access to care for Marylanders, which they very much deserve and we absolutely support. NPAM supports license portability. Unfortunately, this compact is not well constructed, and it actually creates barriers to APRN practice across state lines, as you've heard. And the so-called APRN Advisory Committee that you heard about in previous testimony is uncodified language. It's not part of this compact. We remain hopeful that the NCSBN will hear our concerns and welcome us to the table to finally come to a compact we can support that fits the needs of the APRNs and and the patients we care for. But until then, we cannot support this compact. And I ask for an unfavorable report. Thank you.
You're welcome. Thank you for your testimony. Next, please.
Chair, Vice Chair, members of the committee, Sarah Peters with Hush Blackwell Strategies, representing the interests of Nurse Practitioners Association of Maryland, which, as you know, whose membership includes advanced practice registered nurses, for whom this compact directly impacts. And we don't support it. We were told last year, jump on the bandwagon. All the states are going to move this. Well, let me go through the list. Hawaii didn't pass it. It's a study bill. Texas hasn't passed it yet. Kentucky hasn't passed it yet. New York hasn't passed it yet. Missouri hasn't passed it yet. But don't worry, South Dakota has. So listen, we haven't been sitting on our hands. In good faith effort 2 interims ago, we met over 9 months with the stakeholders. We talked compromise. Fortunately, compromise is not practical in a compact. We consulted some analysts here with your committee, and they advise changes aren't frequently happening because what has to happen in a compact is legislation has to be introduced in every single state. Every single state would then have to pass that bill. Well, we know how legislation gets passed and how impractical it would be to have changes made through amending legislation in each compact state. So it's not feasible. They say it's easier once you're in it. Again, for those very reasons, it's not easier when you're in it. Every state would have to pass legislation. And then this past interim, we said, okay, good faith effort. We want a compact. We want a compact, not this compact. So NCSBN, welcome us to the table. We're ready to have the conversation. They voted again to push this very compact we have concerns with. And then lastly, again, we're not sitting on our hands. We're all for increasing the providers in our state. There is a reciprocity bill that we're very much supportive of, and any efforts along those lines, we will continue to be supportive of. Again, just between the practice hours, us not having a seat at the table, us not being able to prescribe controlled substances, and for a few other reasons, can't support this bill.
Thank you. Next, please. That's quite a statement, Dan.
I promise not to throw any more.
You
furniture.
better have an amazing testimony now.
Well, Madam Chair, members of the committee, I'm Dan Shattuck here today on behalf of the Maryland Society of Anesthesiologists. I serve as their executive director. We're here in opposition to House Bill 425. Generally, we're supportive of compacts. We've been supportive of the number of compacts that have come before this committee over the years. This bill, however, as the compact is drafted, supersedes state's law, particularly around collaboration and supervision. The compact in its language does not clearly define collaboration or healthcare provider. In fact, unlike any other compact law that's been passed in the state, this compact specifically states that an APRN issued a multi-state license is authorized to assume responsibility and accountability for patient care independent of any supervisory or collaborative relationship. And then additionally, this authority may be exercised in the home state and any remote state which the APRN exercises a multi-state licensure privilege. In its bold, plain-faced language, that is clear that supervision, collaboration does not apply when this compact goes into effect. And it allows those who are already licensed here in Maryland, when they join the compact, then they abide by the compact laws and not the state laws. Now, there is language. I've had some conversations with the opponents. They did provide me their interpretation of the arrangement and how collaboration supervision would work, but that's not spelled out in the bill, and it's not in alignment with what exists in Maryland law. Furthermore, the language that's in there, that's pointed to in the testimony, I think it was referenced as well in their testimony, that the licensee shall continue to collaborate with their healthcare providers in a collaborative fashion or as necessary for patient care. But again, collaboration is not defined, healthcare providers not declined. So without some clarity or amendments, we have to oppose this bill. Thank you.
And thank you for your testimony today. We're going to open it up for questions now, okay? So the first person I saw was Delegate Hill, followed by Hutchinson.
Thank you, Madam Chair, and thank you all for the work you've been doing on this over the years. What is the problem, as you see it, with passing it and then the advanced practical nurses who don't want to participate just don't participate? Why? What is the problem with that? Reciprocity agreement, if that can be worked out, some are under this, some aren't under anything. They just go state by state by state and get licensed state by state by state. Why not have every option on the table?
Yes, who's
Okay,
the
Lindsay.
best person to answer it?
So the biggest issue is that it affects our new graduate APRNs. So when they graduate from their school and they pass their board certification, we are saying that they are safely prepared to care for patients in the state of Maryland to treat, for example, acne. Treating acne in West Virginia is no different than treating acne in Maryland. So the workforce that currently meets the 2080 hours, we know, is retiring every single day. So this is going to affect our new practitioners who need to be able to see patients right away to provide care, and they will not be able to have a multi-state license.
Yes.
So what I'm confused about is so there's a new graduate and they don't want to go through the 28, so they could apply to West Virginia separately, a little bit more expensive, and apply to Maryland. They wouldn't have to get these additional hours, right? Because that only applies for people who are licensed under the compact. It doesn't change independent licensure in each state, or am I wrong about that?
Who's the best person?
No, yeah, go ahead. Or Claire, do you want to go?
I don't, Janet, why don't you answer?
Oh, well, from my perspective, it seems that then you're not solving the problem of improving licensure portability. Everybody can still go get a single state license. So why not have a better compact that removes the practice barriers, doesn't send the bad message that nurse practitioners aren't ready to practice after graduation? We would like to come back to the table and negotiate something that isn't so negative, that's easier to administer. We're also worried because you can't amend it unless every single party state enacts an amendment into law. So to us, that's like, well, nothing's ever going to change. So if it gets passed now, this is what we're stuck with, good or bad. So we want something better. I guess that's our point.
And to your point about reciprocity, it's a much simpler process.
Delegate Hutchinson.
Thank you, Madam Chair. My question is to the panelists here on the far right. And when you opened up your statement, you came out saying there are 6 things wrong with this compact, but you focused on the nurse registry. I don't know whether it was a coordinated effort that you.
It was.
Okay.
Tried.
You got them all covered then.
And it's well documented in our written testimony as well.
An opportunity.
Yep.
Thank you.
Thank you, Delegate Hutchinson. We have next Delegate Chisholm, followed by Rosenberg.
Thank you, Madam Chair. My question is really for Sarah. So you said that we do have a reciprocity bill that has been drafted and is going to come to this committee?
Yes, it's House Bill 146.
Solve all the problems that the APRNs currently see with the compacts, is that correct?
That is my hope. We have been coordinating with Board of Nursing very preliminarily, and I think that they have some questions about how that could work or if it could work. But the reality is all signs would indicate for us that it could be a very valuable opportunity for us.
Absolutely.
And for the proponents of the bill, I believe when they came up, it seemed like the APRNs were just one of the groups that were left out of the reciprocity bills that included all the other nurses and therapists. Is that correct?
I don't think so. I mean, if you're talking about House Bill 146, that would empower, as I understand it, health occupation boards to have reciprocity agreements and make the rules to implement them. So it's a possibility for the Board of Nursing. That may be something very good.
It was really the reciprocity has been offered to several other groups, just not APRNs at this point.
Yes,
Yes,
some
correct.
boards have said.
Yes.
Thank you, Madam Chair.
And if I may just, as a follow-up to this, so, because it will make more sense now to ask it. For reciprocity, it depends on what state has reciprocity, right? So it's not just that Maryland can decide, the other state has to do it, correct?
Right.
All
It
right,
has to be an agreement.
that's right. Thank you. We have Delegate Rosenberg followed by Alston.
Thank you, Madam Chair. It's my understanding that all nursing groups in the state participated in a work group this session, and that you are the only nursing group that chose not to agree to that outcome. Is that accurate?
That is not accurate. As I said, my name is Lindsay Ward. I'm the president of the Maryland chapter of the national, across the whole state, whole United States, pediatric nurse practitioners. We are a completely separate group. We have over 204 members. I just checked 2 days ago, and we represent acute care and primary care pediatric nurse practitioners throughout the entire state of Maryland. So there are two groups, not one, NPAM and the Maryland chapter of the National Association of Pediatric Nurse Practitioners. Our national organization also opposed to this bill, and NAANP, so many organizations, but our national organization also met with the NCSBN. We were also part of the work group, and our voices were not heard over those 9 months as the pediatric nurse practitioners.
And congratulations on your position.
Thank you.
You're welcome. I have Delegate Alston.
Thank you. My question is for Lindsay. Lindsay, right?
Yes.
Okay, perfect. You, in your testimony, you spoke about not being able to prescribe across state lines if you had a patient who had been diagnosed with, I think you said ADHD. Is that just for that particular disorder, or would it be for all disorders and all types of prescriptions? In particular, I'm concerned about something like methylprestone. If a person needed to prescribe that, would they be able to prescribe it if they were in this state, or would they be prohibited?
So to clarify, different states have different laws, especially regarding controlled prescriptions. So ADHD medications, stimulants, your Adderalls, your Ritalins, and then also pain medications would be in there. And also like the buprenorphine. So anything that's controlled. So substance abuse treatment. Of course, as a pediatric nurse practitioner, I'm not likely going to be treating that. But I may not be able to even fill my patient's prescription, even though I can see them, because that state says nurse practitioners, APRNs, cannot prescribe controlled substances at all. I could only prescribe a specific amount. So maybe 3 days, or I'd have to have a collaborative agreement with someone, which could be upward of $1,000 a month to treat them and be able to prescribe those medications. So it's not, it could prevent me. And that is state by state. I would be responsible for looking up what those states' laws were, for knowing them, for educating my patient, so I don't send a prescription to the pharmacy and then they can't get it filled. I hope that answers your question.
You have a follow-up?
It did answer the question, and I guess where I'm concerned, is it just the controlled substances, or is it all substances? Because I know another witness talked about other substances, but if someone could let me know if it includes all prescriptions or just controls.
So different states have different allowances for any kind of prescriptive. Some states have a collaborative agreement that they have to list, that the nurse practitioner has to list every medication that she plans to give, and the physician then approves that they can give that medicine. So it depends, it's very much state by state.
If I may, I don't know if this helps, but there's basically,
Wait,
I'm sorry.
I'm going to allow it, but we usually just allow the one person.
I'm
But
sorry.
go ahead, go ahead.
No,
No,
well,
go
I was just going to say that the language within this particular compact is messy and it's not cohesive. That's the problem.
Doesn't address.
It doesn't address the differences between all of the states. I apologize.
Oh, it's okay. Delegate Bandari.
Thank you, Madam Chair. One of the common opposition we say is regarding its potential to supersede our state law in licensure and scope of practice. Could you educate the committee that how do you propose we balance the need for uniformity and mobility of APRN practice across the states with the preservation of our autonomy in setting healthcare standards and ensuring both patient safety and access to care are not compromised?
It will probably be easier to come, like move the seat. Thank you for your flexibility.
That is a problem with this current compact that's before you, is that that is not addressed in this compact. So it doesn't address that piece. It says if you accept the compact, you accept what the compact says. And there's many parts of it that are not even defined. So it does not address your state autonomy. Does that answer your question?
Solution.
Well, there are things like reciprocity, which some healthcare organizations in the state of Maryland have, which allow them to say, hey, we're similar. We have similar practices. We do things similar ways. We're next to each other. It makes sense for us to collaborate. It makes sense for us to allow that because then we do maintain our state's autonomy with how we should practice. And it allows for then unanticipated developments in healthcare to go forward and not be held to. Okay.
Okay.
Does
All
that help you?
Yeah. Any other questions? And just for.
There's 27 full practice authority states.
Just, we can do that. Okay?
Sorry.
It has to be orderly, right?
Sorry.
Because it's a process have to be orderly, with all due respect, okay? So I have a question for clarification. The bill as it's drafted does not change anything for you to practice here in Maryland, correct? Like our laws are left intact in Maryland.
I think that's correct. Yeah, that's correct.
That's
Okay. The bill as drafted will be if you want to practice outside of Maryland, right? It isn't the idea to get rid of some of the red tape. I know it has issues, but isn't it to get rid of some of the red tape to make it easier to obtain that license?
So then when someone from another state comes to Maryland to practice here, they will automatically practice under the compact, not under our state. So they will be held to the compact language.
Right. And the same goes if Maryland were to go to another
Right.
state.
So it
correct?
works both ways.
That's right. Okay.
Yeah.
Delegate Hill.
Chair.
All right.
So if the compact, again, it doesn't apply to everyone in the state, those who choose to participate. When you say that someone coming into the state from state X, primary licensures in state X, does that mean that their standards that they function under might be different from the standards that a primary Maryland licensee would have? And also, would it mean, back to the point that was made earlier with Delegate Alston, we know that abortion access is a big issue. So we're participating in this compact. And as you understand it, put people at risk if they were doing something legal in Maryland, and allow for other folks to prosecute them because it's illegal in another state.
May I take a stab? I think in looking at this compact and again, how it's drafted, it seems very clear that the compact will be the body of law by which all the licensees of the compact would abide by. It would supersede Maryland law in that in certain areas of Maryland law with respect to advanced practice nurses, there is still collaboration. The written agreement may be gone, but there is still a functional collaborative relationship that is not defined in the compact. And the compact itself would then be an unchangeable entity for this body. Essentially, if there's a change in scope of practice or if there's a change in the duties that are delivered by advanced practice nurses, that is out of your hands, so to speak, and in the hands of the compact entity. And to the extent that the state or representatives have access on that body is another discussion. But I think unlike the other compacts that have passed this committee, those compacts have specifically stated we will not supersede state law. You come into the state and you from another state, you're going to practice according to the state laws that are here in Maryland. If you go to Virginia, you're subject to Virginia laws. This is trying to overlay that and say this is the scope, and that the state of Maryland will agree to abide by that. And I think that's fundamentally of concern, and it steers differently than every other compact that's passed.
And just for clarification, this committee passed a bill last year, the shielding law that protects abortion providers. So just want to clarify that. That takes care of that. Anyone else? Seeing none, thank you so much for your testimony.
Thank
and
you
I
for your
love how you
patience.
work together there.
Thank you. Thank you.
Oh, Delegate Johnson, you had a question.
Uh-oh.
You have
That's okay.
to speak quickly. Go ahead. One second, I apologize.
That's okay.
I was a little late, Madam Chair, because after the
A little late to the
final
dance.
statements, I was
Go
reading
ahead.
through the bill, and I just wanted some clarity, because you're saying it would supersede state law, but it said invest all party states with the authority to hold an APRN accountable for meeting all state practice laws in the state which the patient is located at the time care is rendered. So wouldn't that mean that they would have to obey all of our state laws?
Well, this is where the drafting of the compact gets murky, because when you look at even the definitions and how they define state practice laws, there's a two-part definition, letter U, number 1, and it's defining, okay, this is what a state practice law is. It's a party state's laws, rules, and regulations, so on. That seems fine. But then it goes on to say state practice laws does not include a party state's laws, rules, and regulations requiring supervision or collaboration with a healthcare professional, except for laws, rules, and regulations regarding prescribing controlled substances. So there's some conflict there. And then further on in the bill, when it's talking about general provisions and jurisdiction, jumping down to page 9, it talks about the statement I read earlier that an APRN who's issued a multi-state license can operate independent of any supervisory or collaborative requirements. Now, for the nurse practitioners, they have full practice authority, but there are others, again, like the nurse anesthetist, that don't have full independent practice authority. So that puts the state at odds with the compact. So it's unclear.
It's okay, not a problem. We're still here. Thank you. Thank you so much for being patient and for sitting back again. Now you may get up.
Thank you.
Hope you have a blessed day. We are going to call a favorable panel and then unfavorable again. Okay, so the favorable now is Celine Alborn. I hope I pronounced your name correctly. Are you here? All right, wonderful. Tammy Bresnahan, Jane Crankit, sorry. I need glasses and I have them on, okay? So let's just go with that. You're not gonna join her? Are you it? Oh, she's coming up? Okay. And where's Janet? Jane, for the Maryland Hospital Association, not, okay, great. Begin, you're enough. Go ahead.
Good afternoon, Madam Chair and members of the Health and Government Operations Committee. My name is Tammy Bresnahan. I'm the Senior Director of Advocacy for AARP Maryland. And ARP Maryland, you have my written testimony, so I won't go into all of it, but something that you may or may not know, at our national office in Washington, DC, we have something called the Center to Champion Nursing in America. So we have a whole think tank and we work very closely with APRNs, all kinds of nurses across the country to make sure, because we believe the APRN Compact will enhance and improve healthcare access in communities across Maryland and across the country, supporting patients and nearly 730,000 family caregivers that help keep the loved ones safe and independent in the communities. That's why healthcare providers, if you've tried to get an appointment with your doctor recently, most often you're seen by their APRN, and we really respect this compact. I know that you have your work cut out for you. You've heard a lot of testimony today. We are here to support Delegate Rosenberg and House Bill 425. We ask for a favorable report. Thank you.
Thank you. Next, please.
Good afternoon, Chair Melnick and Vice Chair Collison. I'm Sally Ann Alborn. I am the CEO of Maryland Community Health System. We are a network of 7 federally qualified health centers with 55 care delivery sites throughout the state of Maryland, primarily in rural and underserved suburban and urban areas. FQHCs, as a lot of you know, are deeply committed to providing access to healthcare services to Maryland residents, whatever their economic or social situation. However, like many other healthcare providers in Maryland, the health centers continue to experience clinical staff shortages. Recruiting clinical staff is particularly challenging for the health centers because we're already located in health professional shortage areas where the federal government has already documented that we are lacking in an appropriate number of physicians or nurse practitioners and others to serve the population in that area. One solution is to have Maryland join the Advanced Practice Registered Nurse Compact, which will increase the pool of nurse practitioners and nurse midwives who would be available to provide care, primary care and pregnancy services to our health center patients and expand access to care, which we desperately need to do. I respectfully request a favorable report for House Bill 425. Thank you so much for your attention.
And thank you for being here. Are there any questions for this panel? Seeing none, I want to personally thank you. The federally qualified health centers are really unsung heroes. You do so much that people do not even know for everyone in Maryland. So I want to thank you on behalf of the committee. Okay.
Thank you very much. And as a nurse who's practiced for 60 years in the healthcare arena, I graduated with Florence Nightingale. I want to personally tell you that I believe joining this compact will be a game changer for us and will help remediate a very serious clinical provider shortage in the state. Thank you again.
Thank you. Well, you have a blessed day. Thank you so much for all you do and for being here with us. We're going to go to you have a question? Okay, I'm sorry. Delegate Hill, 1 second.
We're flexible.
Yeah.
Thank you. Could you address the issue of the additional hours that was raised by the other panel and how prohibitive or problematic that is from their perspective?
I don't view it as problematic. They would have to practice for a year and then they join the compact.
that I've known have had problems finding people to monitor their hours as it is without it being specified. And that has been an issue where they're traveling 2 or 3 counties away from where they live in order to just find a preceptor to do it. And now if you're specifying not that you have to have a preceptor for a year, that preceptor has to actually give you X amount of hours, so many hours a week. You don't see
This
that as
doesn't
a problem.
require a preceptor. The bill, as I understand it and have read it, doesn't require a preceptor. It just requires that you work for a year. Then that doesn't mean you can't work as a nurse practitioner. Just would be part of the compact in another state.
How do you get the hours if it
So
doesn't
if you
require a preceptor?
graduated from the University of Maryland as a nurse practitioner, the next day, if you, once you pass your boards, then you could go to work as a nurse practitioner. What you wouldn't be able to do is if we were part of a compact with Delaware is to be able to join the compact and work in the compact in Delaware. Yeah, you could still practice as a nurse practitioner. That's not going to inhibit that at all.
But if I
Yeah.
may to clarify, you could practice here in Maryland, but
You
you
can
cannot
practice here in
practice in Delaware till you do that.
As soon as you're boarded,
Yeah, okay,
as soon as you're boarded.
thank you.
Florence and I graduated, we went to work the next day.
Thank you very much. Take care. So let's go to, will you be so kind for the virtual? I want to be fair, so let's go to the unfavorable. The unfavorable fair, because she's only one, okay? And it's actually Nyla Russell. If you see Nyla Russell, if you can let her in. She's there? Good afternoon, Miss Russell. How are you?
I'm well. How are you?
I'm doing well. Thank you for waiting and for being patient. Can you get started, please?
Yes, I can.
Thank
One
you.
second.
Thank you.
Great. So, hi, Madam Chair and members of the committee. Thank you for this opportunity to testify virtually. My name is Dr. Nyla Russell, and I'm the past president for the Nurse Practitioner Association of Maryland. I'm also a military spouse. I voiced a number of concerns about the compact to most members of this committee, and I do refer you to my written testimony. But today I want to talk to you about the compact as a military spouse and my experience with Maryland and other boards of nursing. Based on their own reporting, the Maryland Board of Nursing has been overwhelmed with more than 6,000 open cases. Some of these are cold cases, which are more than 3 years old. I have concerns about them being able to administer a compact and adjudicate current cases. Fortunately, this body recognized the need for the Maryland Department of Health to take over the board, and the newly formed board has been restructured, and I'm hopeful they will succeed. The Board of Nursing should use reciprocity to model legislation which would positively impact all advanced practice registered nurses. In 2023, President Biden signed the Military Spouse Licensing Relief Act. Under this law, licensing reciprocity between states would apply to the profession of nursing. In July of 2023, the Department of Justice notified all state licensing officials about new employment-related federal protections for military families. As you can see, this federal legislation negates the argument that we need a compact to aid licensing for military spouses. Reciprocity is the best solution for portability of licensure. License reciprocity is like a mini compact. It fast-tracks licensure by allowing the Board of Nursing to decide which states are comparable to Maryland. Simply put, it's a reciprocal agreement between states that would allow them to say, okay, you have high standards, you vetted this APRN, and we will allow them to practice. This is something you can do now. Maryland doesn't need to wait for 7 states to enact a compact. We control our fate, and the board should determine which states to form reciprocal relationships with, not the National Council of State Boards of Nursing. I request an unfavorable report on House Bill 425 and urge you to consider license reciprocity as a better option. Thank you for your time.
Thank you, Dr. Russell. Are there any questions for Dr. Russell? Seeing none, thank you for being with us this afternoon. We really appreciate you, okay? And thank you, your spouse, for your service. Thank you.
Thank you.
You're welcome. We have 3 witnesses left, and they are actually virtual, so we're gonna call all 3 of them. Will you be so kind? And thank you so much, ladies, for your patience. Okay? Let me know when they're here. Okay, wonderful. I saw first Miss Captain Nash. Are you there? Captain Nash? No? Well, let's go with Ms. Stowens and then Mr. Arno.
Good afternoon. Thank you so much, Madam Chair and members of the Health and Government Operations Committee. My name is Sarah Stowens, and I'm giving comments today in support of HB 425 on behalf of Christiana Care. Nurses have been on the front lines of every healthcare crisis we can think of and demonstrated their resilience and passion for what they do. The compact before the committee today demonstrates offers our APRN colleagues a streamlined process, improved efficiency, and reduced barriers and cost for multiple licenses. This practical flexibility would enhance the coordination of care among healthcare professionals, fostering a more integrated and patient-centered approach. At Christiana Care, we have been and continue to be supportive of this legislation. Our APRNs are uniquely positioned to utilize the flexibility offered immediately upon the passage of this compact in 7 states, as it has already passed in Delaware, as has been said. Not only would APRNs be able to take advantage of compact benefits, but our healthcare system, which operates in Delaware and Maryland, would be able to address provider shortages to our Maryland communities quickly, alleviating strain on crucial specialties like primary care, emergency services, oncology, and behavioral health. In short, the hundreds of APRNs employed by Christiana Care would be able to practice at all our locations in Delaware and Maryland, increasing access for our patients and patient safety. As healthcare continues to evolve, legislative measures like the APRN Compact play a crucial role in optimizing the delivery of healthcare services and will allow us to expand access to care, address healthcare workforce challenges, foster collaboration, and enhance overall healthcare quality. I respectfully request a favorable report on HB 425. Thank you.
And thank you. It was great seeing you yesterday.
Yes.
You know, you were going to be
So
here
lovely
today.
to have that time. Thank you.
Great to see you. And next we have Captain Nash, Lynn Nash, who, by the way, served in the Army in the U.S. Public Health for 30, she's a 30-year veteran, and how great it is to, as a woman, call you Captain Lynn Nash. Welcome to our committee. Go ahead.
Thank you so much. Obviously, I'm in support of this legislation because it improves portability and it's actually very common sense. It's been supported by 15 organizations, including the National League for Nursing and the National Military Family Association. And Chris Arnold will talk to you more about the Department of Defense and why it has not only helped fund this compact, but why the Department of Defense has actually utilized it for or been working on this issue for 16 years. But I think my time would be better served by just kind of clearing up a couple of differences here. So reciprocity is a separate agreement state by state. And our overworked State Board of Nursing really doesn't need to be spending time working on 55 different agreements. And secondly, in regards to the Veterans Auto and Education Act, I respectfully disagree. According to our Maryland Department of Labor, it clearly states that a service member or spouse applying under this act is not an application for licensure or certification, but simply a letter of endorsement. And that letter of endorsement would not be recognized by the Joint Commission on Hospital Accreditation as meeting the requirements for licensure. So we represent over 150,000 veterans here in the state. We strongly support this bill, and thank you to Delegate Rosenberg for sponsoring it again this year. Thank you.
Thank you very much for your testimony and your service. Next we have Mr. Arno.
Madam Chair, the Department of Defense, to the Department of Defense, maintaining high standards in healthcare is non-negotiable. The APRN Compact aligns with this ethos in a time when military families face constant relocations and unique healthcare challenges. Interstate compacts offer a beacon of stability and excellence in healthcare, reinforcing Maryland's unwavering commitment to those who serve our nation, including Maryland residents currently stationed in other states. The President in 2023 signed the Veterans Auto Education and Improvement Act, which allows for recognition of out-of-state licenses. And the law specifically states that interstate occupational licensure compacts, such as the APRNC, are prioritized within the federal provision. Additionally, while Maryland's licensing agencies are now required to recognize out-of-state licenses as valid, Maryland employers are not. For military families, the ability to practice in different states without the need for multiple licenses is crucial, especially considering frequent locations and deployments. Obtaining a license in a new state can be both time-consuming and expensive, and military spouses cannot adequately anticipate how to prepare for licensure in a new state due to the unpredictable nature of military moves. The compact not only enables active duty military spouses to practice to the full extent of their education and training, but all practitioners of the occupation who benefit from the mobility provided through compacts while sustaining the focus on assuring public safety through licensure. Common misinformation about compacts includes that the multi-state license either lowers, raises, or supersedes the standards for an occupation. However, an individual may still apply for a single state license. Reciprocal licensure regimes are insufficient to meet the underlying needs of military spouses. There is consistent evidence that the multi-state licensure model has significantly improved employment outcomes for nurses married to military personnel, increasing labor force participation by 5% and the probability of employment by 8%. I'm here to answer any questions you may have, Madam Chair. Great to be before HGO twice in one day.
I don't know if that's a good thing. Anyway, are there any questions? Seeing none, thank you very much for your testimony. We really appreciate it. And to all of you who came and testified, whether you were favorable or unfavorable, we really appreciate you, okay? And we listen. Our bills go to subcommittee, and I have a policy of allowing everyone to come. I mean, whoever you testify here have an interest in it. I hope you have a blessed day. This actually concludes the bill hearing on House Bill 425. And thank you for being patient. We now have 2 more bills left, and I want to thank those of you that are waiting to be called for being patient. And we're going to go on with House Bill 354. Thank you, Delegate Collison. Delegate Collison, Maryland Pathway to Nursing Program and Advisory Committee Establishment. Will you be so kind and bring your panel, please?
Good afternoon, Madam Chair,
Good
HGO
afternoon.
colleagues. Thank you very much for the opportunity to present this bill to you, Maryland Pathways to Nursing Program and Advisory Committee Establishment. There are some amendments to the bill that you can see in the floor system, I believe, that align it with the Senate bill. The substantive changes that those amendments make will reduce the fiscal note, and I'm going to ask Ms. Elliott to speak to that when she during her 2 minutes. This bill, we're talking about our nursing shortage. I mean, today has been a lot about that, and we hear almost every week about our healthcare workforce shortages, and we're looking for innovative ways to address them. And I believe that it would be a great resource. This Pathways program is a great resource towards addressing that issue. And we're already seeing those results in Baltimore County under the leadership of County Executive Olszewski, who was, supported and sponsored this program in Baltimore Community College. And it makes a difference. We can't move forward with response to our in relationship to our health outcomes and addressing our disparities and equities if we don't address this shortage. And the way this bill proposes to do that is to model the program that is happening in Baltimore County and put it ultimately, after doing some study and some development by the Department of Health, into geographically disparate areas. So we can begin to address the shortage actually in areas where they need it. The unique thing about this program is that it provides the kind of wraparound services that folks need in order to be successful. We find that we have a cadre of certified nursing assistants out there. They are already committing and dedicated time to helping people. But in order to move forward in the profession, they need to access higher education. And that's not available or affordable to them. So that what this program does is will provide the resources and the wraparound services that they need in order to be successful in achieving the licensed practical nursing certification. And if they choose to go beyond that, that's wonderful. But I have been in several different meetings with hospitals, and they all tell me they need more LPNs because they need to beef up their nursing workforce. Unfortunately, the folks who are that we're not getting the younger generation in this pool. The folks who are older, who would be beneficial to this pool, they're working, they have children. So their schedules, they have transportation issues. And in my written testimony, you'll see a reference to an organization that is talking about how do we really develop this workforce by providing the resources and supports that they need to get there. I'm going to ask you to not be frightened by the fiscal note. As I said, we are addressing it in some amendments that came from the Senate. I am aware of the concerns of the Maryland Department of Health, who are afraid that they're not able necessarily to have the capacity to develop the program. We are in conversations to see, where is the best place to put this program in order to make sure that we can move forward. In addition to defining the program, there is an advisory committee. You're on a good committee when other people ask to be on it. So one of the things, the amendments you'll see in the written testimonies that you have, are the desire for other organizations to add into the advisory committee. So with that, I'm going to thank you for your consideration and humbly ask for a favorable report. And I'm going to turn it over to County Executive Olszewski, who has been waiting all afternoon and he has to go. So I'm going to let you go first.
Thank you, Madam Chair. Good to see you again.
Nice to see you.
Madam Vice Chair and Bill Sponsor, thank you, Delegate Cullison, all the members of the Health and Government Operations Committee. It's wonderful to be with you. For the record, Baltimore County Executive Johnny Olszewski, proud former member of this body. Proud to be joined by Dr. Jennifer Lynch, who's our Senior Policy Advisor for Education and Workforce, who also helped create our program in Baltimore County. I'm here in strong support of House Bill 354, which seeks to replicate a lot of the successes that we have seen in Baltimore County. We know that this is a program that we had the opportunity to, a year ago, come before you, and we were grateful for that, to talk about our new Public Health Pathways pilot program. It is a comprehensive program that guides underemployed and under-resourced residents to obtain a job, to obtain opportunity, and to obtain family-sustaining wages and careers in healthcare. In addition to free tuition, books, fees, and uniforms, our Public Health Pathways program offers a customized school and work schedule, as well as mentors, tutors, and a monthly stipend. These are resources that have allowed our participants to overcome workforce barriers like housing, food instability, while still pursuing their goals. Just 1 year after the program, I'm proud to provide initial results. 100% of our participants received their CNA. This is higher than the typical rate of 75 to 80% with our partner community college. 100% are hired as full-time CNAs with full benefits by the University of Maryland Medical System. Participants are now making approximately $3,500 a month and have full benefits, including health insurance, paid time off, access to retirement, and perhaps most impressively, 21% of our participants have already passed all the prerequisites and are now entering into our LPN program. That is 5 times higher than the percent of students who typically move from CNA to LPN. These are students that are well on their way to family-sustaining jobs and meeting their needs. So we're excited about what our pilot has done. We're proud to support Delegate Cullison and this committee in seeking to expand that work across Maryland. So thank you very much.
Thank you and congratulations. It's really very
excited.
successful.
Yeah,
Thank you and thank you for being here. Next, please.
Good afternoon, Robin Elliott here today on behalf of the Maryland Nurses Association. I'm going to tell a small story about how this bill developed, and then I will address the fiscal note. Last year, the Maryland Nurses Association, in collaboration with many partners, did a lot of rigorous brainstorming about what to bring forward to address the nursing shortage. And what they kept coming back to is the fact that early in the nursing education pathway, there is a very high level of attrition, particularly in community colleges, because those students are doing other things, as Delegate Cullison spoke about. So it's very hard to grow more nursing faculty. We would love to do that, but it's challenging. So if we can keep students enrolled and successful, we can very much increase the number of LPN students who graduate and then go on to be able to be licensed as LPNs and then further on to RNs. Now, the fiscal note, on the Senate side, the Senate bill, which is cross-filed by Senator Lamb and Senator Mike McKay, includes some changes. And those changes are in Delegate Cullison's amendment. And what they do is they make it clear that the program is not going to provide direct tuition assistance. These students are generally eligible for other Maryland programs, but the program will help get them to those financial resources. The second main thing that the amendments do is really speak to Baltimore County's experience, and that is that these programs come together with braided funding. So it's a combination of county funds, or in this case, state funds, hospital infrastructure resources or other health system partners, workforce development funds through the feds. It's not one size looks alike. This program is set up so that each jurisdiction can design what works for them. And so last but not least, I just wanted to note, I think this may be the only bill that I've seen thus far that is programmatic in addressing the nursing workforce shortage. I could be wrong. I have not read the Senate synopsis from last night, which is 93 pages. And I'm a little scared of your House synopsis next week. But thus far, I think that is the case. So this bill really kind of stands up and shines for that reason. Thank you.
Thank you. Next, please.
Thank you, Madam Chairman. I think I can yell loud enough. That'll work. Thank you, Madam Chairman. Peggy Townsend on behalf of the Maryland Hospital Association in strong support of this bill. With regard to LPNs, their vacancy rate today is 16%. And one of the reasons for that, probably 2 decades ago, everybody was going to an RN only model. And given what has transpired in the last 20 years with workforce shortages and RNs in particular, hospitals and others have had to then reach back and do what we did back 20 years ago, which was have LPNs and CNAs as a much more integral part of the team of care. So the individuals entering LPNs and GNA programs are not, they're entry-level positions. So those individuals often have barriers that maybe you and I would not have to getting training in this space. They have childcare needs. They're working a first job. They have transportation issues. And I will tell you, I've served on the Baltimore Workforce Investment Board as well as a healthcare investment board. They're workforce intermediaries that train people. But what we find, in order to get them to the other side and complete the training successfully, you do need some wraparound services to help them complete the program. They have additional challenges, and in order for us to really address the problem and get them through to the other side, wraparound services are very essential. And so for those reasons, we would very much support this bill.
Thank you. Thank you, Peggy. Next, please.
Good afternoon, Madam Chair and distinguished delegates of the committee. My name is Crystal Beckford, and I'm 32 years a nurse, 29 of those years a registered nurse. Today, I serve in the role of Chief Nursing Officer at Luminous Health Doctors Community Medical Center. Luminous Health is a 600-bed health system with over 80 sites of service delivery and serves both Prince George County and Anne Arundel County and its supporting areas. I stand before you to express my unwavering support of House Bill 354, establishing the Maryland Pathway to Nursing program. Personally, I took a very unconventional path to nursing because I had to. This opportunity, if afforded to me 32 years ago, would have been exactly what I needed. In my experience, things were limited at that time, and that is why today I stand before you to express my support. This bill, supported by the Maryland Department of Health, is both innovative and aims to enhance the nursing profession in our great state of Maryland. It has the opportunity to increase the number of nurses who can enter the profession, who may previously have experienced barriers such as cost or access, and ultimately it enhances our nursing profession, allowing for greater diversity of our workforce so that the workforce better represents the community in which we serve. I am especially excited about the House bill's proposal to establish a pilot program at 2 community colleges that offer LPN programs before implementing it statewide. This is a great approach because it will allow for careful evaluation and refinement of the program, ensuring its effectiveness and success. I see key advantages for this program. And the importance for the community colleges being an integral part of the system. Again, by implementing the Pathways to Nursing program, we're taking a proactive approach to address the nursing shortage in Maryland. This not only will benefit our future nursing workforce, it will also support our state in a constant effort in which we all serve as benefactors and improve the quality of patient care and healthcare outcomes in our state. Thank you.
Thank you. Thank you for your work and for being innovative. Next, please.
Good afternoon, Madam Chair and members of the committee. My name is Allison Taylor on behalf of Kaiser Permanente, and just here to say me too.
You know, the committee loves that testimony. Next, please.
And I'm Jennifer Lynch. I'm the Senior Policy Advisor for Education and Workforce Development, working with County Executive Secretary. I do not have additional testimony, but I am here to answer any questions that you may have about our pilot program.
Thank you. I'm going to open it up for questions now. Are there any questions from the committee? I saw Delegate Alston first. Go ahead.
Yes, Mr. County Executive, how would you make this a national program?
Honestly, if I may just use it as an opportunity, Delegate, to just say, as we think about cost on this program, I think what's lost is the fact that like we are actually putting money back into the economy by, so actually like what's not captured, I'm sure in the fiscal note, is the fact that these individuals are not only meeting a critical public health need, but we're also putting them on a pathway to earn these wages in a way that as someone who's responsible for a budget as well as you all are, we're seeing the income taxes and the property taxes. And so for the investment, we both meet the need and we're seeing the benefit. I would love to see our state help scale this here. And actually had the pleasure to go to the White House because there was interest in this model with the National Association of Counties because they did express an interest in what would happen here. So I think whether we can scale it at state or across the country, it's something that is a need everywhere. So thank you for the question.
Thank you. We have a sense of humor in this. You have to. They're long days, right? Delegate Rosenberg.
Thank you, Madam Chair. We'll continue
welcome.
where you hope to go. They don't care about budgets like we do here. But in the bill, is there any language? I'm trying to put my former Appropriations Committee hat on. Is there language in the bill, or could there be language in the bill that, since it's an out year, would address the fiscal note? And is there matching money to implement this potentially, which also reduces the cost? And Robin, you're appropriate to respond to a fiscal question.
Yes, Delegate Rosenberg. So the way that the program is set up is that the establishment of the pilots at the community college would be in a future fiscal year, because there needs to be planning and a run up. In the amendments that Delegate Cullison is introducing, very specifically speak to this concept of braided funding, and that truly is that every partner involved in these programs contributes in some way, whether it is actual fiscal resources or in-kind resources. And so that will definitely, one, bring down the fiscal note, but because everyone's contributing, that also knits a very close partnership and ownership over the success of the program, which is one of the reasons why I think we see such signs of its success in the Baltimore County program.
Any other questions? You know, I think that we know what fiscal note we have in front of us, right? You're gonna need a new letter. But have you spoken with the governor's office to see if some money can be put in there in a supplemental budget for this kind of program?
I have not, because we were dealing with the changes and I wanted to know where we were landing at this point. So I can now engage in those conversations.
That would be great, because this is something worth just doing it and finding the funds, right? Because it works, and we've proven, you know, in Baltimore County that it works as well. And we do have a shortage, and I honestly haven't seen any other bills that do this right here, which is, I mean, we have to address the shortage of healthcare workers in our state as well. I know we have many choices, but this is definitely one worth doing. It's like you pay now, you pay later. Any other concerns or questions? Seeing none, thank you so much for being with us today, and thank you for your leadership.
Thank you.
All right, we have Tammy Bresnahan, Catherine Ling, Mary Kay DeMarco, Nicole Chapman, okay, thank you so much. Will you, good afternoon, how are you? Thank you for being patient, everyone. I know we have one more bill. We really appreciate your patience. Can you please get started?
So good afternoon, Madam Chair, Madam Vice Chair, and distinguished delegates. My name is Catherine Ling, and I am here representing the Maryland Nurses Association. For full transparency, I am that rare bird known as a nurse educator at Johns Hopkins in their School of Nursing. I am also a family nurse practitioner. And I am a veteran spouse and Blue Star mom, for context for my comments. Nursing trains without flight, meaning nurses generally become and get incubated where they live. If we are looking for ways to grow nursing and our workforce where we are, we need to take care of them and grow them here where they live. Nursing is a career of lifelong learning with many different on-ramps. You will see that folks start off as a CNA, go on to be an LPN, become an RN. I started off as a home health aide many, many moons ago, as my children say, when the earth's crust cooled. I then have gone on, and I'm now working with my PhD and working with new students. This pathway needs to be illuminated, and all of the on-ramps into nursing need to be strengthened if we're going to have the vibrant, robust workforce that we need. As the city councilman spoke to, there is a secondary and tertiary impact of creating these pathways, and that's of economic stability in communities where we don't necessarily find that we have the access. If we give folks a way through wraparound services to bring work to themselves and their family, we are creating opportunities in those communities for economic stability. You can't be what you can't see. Therefore, we need to make sure that we are creating these pathways. Having lived in a number of different states, I can tell you that those states with these types of pathways have vibrant nursing communities. I urge adoption, and thank you very much for your time.
Thank you. And thank your family for their service. Go ahead.
Okay, good afternoon, everyone. Madam Chairman and members of the committee. My name is Nicole Chapman. I'm coming as just an example of what these programs can do. I'm currently practicing in the state of Maryland as a licensed practical nurse. Just to give a little background, I grew up in Baltimore City. I now live in Baltimore County for the last 10 years. I'm one of 3 children who was raised by a dad who only had a 3rd grade education and a mom who graduated only from high school. I feel that it is important to support this bill to ensure that funding is available to support programs to help improve the direction of nursing. Since the COVID pandemic greatly was impacted by the number of bedside nurses, the nurse to patient ratio at the time now is at an all-time high, greatly increasing the need for nurses at all levels, LPN and RNs alike. Patient care is my passion, one in which I would have never been able to pursue if it were not for programs like the one I am in today. I graduated from the LPN program at CCBC in 2022. I had a 4.0 GPA, and I was able to obtain a GPA through funding like this that was able to help me with bills and childcare and transportation needs. I was able to spend more time studying and less time worrying about financial constraints. I encourage others every day to pursue their dreams as well. Florence Nightingale emphasized the importance of sensitivity, spirituality, and compassion in nursing care. So I ask that you remember these things and vote in favor for this bill.
And thank you for coming in front of us, and congratulations on your 4.0. That's
Thank you
a
so
lot of
much.
work and
It was a
dedication.
lot of work. Thank you.
Thank you. Next, please.
Thank you, Chair Penn-Melnick and Vice Chair Cullison. I am Mary Kay DeMarco. I am the Program Director for Nursing at the Community College of Baltimore County, and I am a former president of the Maryland Nurses Association.
Are you related to Vinnie DeMarco?
I am not related to Vinnie, but I know his work very well.
But you know what? He does a lot of work here and has our
Absolutely.
respect. So it's okay to be associated with him.
I very pleased to share his name and distantly. I am here to support House Bill 354. This Maryland Pathway to Nursing, as you've heard, could really be a game changer for many students in the state of Maryland. Nursing is hard work. Maryland needs nurses, and nursing school is hard, particularly for adult learners. I've been a community college educator for over 30 years. I've stayed in my position for one reason, because I see the changes our community colleges make in people's lives. We change lives. We have a student here today from our program who is a perfect example of that. Unfortunately, I see about 20% of our students unable to get through the first year of nursing school. Part of that reason is not because they are not hardworking and intelligent. It's because they have so many other barriers. Transportation, tuition costs, work, aging parents, children. You've heard the stories. I think House Bill 354 is a pathway that is a win-win. It'll attract minority students. It'll supply wraparound services and increase our workforce. I ask you for a favorable report. Thank you.
Thank you for your work and for being with us today. I'm going to open it up for questions now. Are there any questions for this panel? Delegate Lewis.
Thank you, Madam Chair.
You're welcome.
Thank you to all the panelists for your testimony. My question is for the young lady who graduated from nursing school. Forgive me, could you repeat your name?
Nicole.
Ms. Nicole. So thank you for your dedication and your commitment to people, to patients. You mentioned that one of the obstacles you faced that you wouldn't have been able to face without support of the program was transportation. And I'm very interested in the connection between transportation and healthcare. It's a
Yeah.
social determinant, not just of the care, but a determinant of the, training. Could you
Okay.
talk about what you went through?
Being in a program and having to transport my children back and forth to school, getting back and forth to clinicals, and traveling for studying, libraries and things like that, transportation was needed. So keeping tires and oil changes and things like that, some of the burden was offset so I could take care of those finances also.
You're welcome. Any other questions? Seeing none, thank you so much for being with us and for being patient, okay? Next, we have two favorable with amendments, and they will be our last witnesses for this bill. The first one is Ms. Deborah Brocato, followed by Aaron Greenfield. Good afternoon.
Afternoon.
Good afternoon again, Chair Pena Melnick and delegates. Deborah Brocato with Maryland Right to Life. On behalf of our over 200,000 followers, we do respectfully object to House Bill 354 without an amendment. So while providing support for certified nursing assistants and licensed practical nurses to become registered nurses is a positive in general, we oppose the program being used to recruit participants and train them for the abortion industry workforce. You have my written testimony, and I'd like to say that Maryland Right to Life, again, it strongly recommends an amendment with language that would exclude abortion funding and exclude a recruitment of participants for the abortion workforce. As someone who comes from a family of nurses and having worked in the hospital, I am fully aware of nursing shortages and the need for more nurses. I also will say personally, I worked full-time while I studied to become a nurse, so it is great to know that there are efforts to try and help people become nurses. It is difficult. I made it through, so I'm glad I did. But let's make sure that this program does put more nurses in the hospital and not in the abortion workforce. The Abortion Care Access Act already provides $3.5 million annually with a non-lapsing fund to provide abortion training. Let's make sure that this bill, all the money that would come from this bill, is used to put more nurses in the hospital. So if the goal of this bill really is to provide more nurses and address the nursing shortage, then please let's make sure it does that. Let's add an amendment to exclude abortion purposes from this bill. So we ask for, without an amendment, we ask for an unfavorable report, but in general, we do appreciate the goal of this bill. So thank you very much.
Thank you. Are there any questions for this witness? Seeing none, thank you so much for your testimony today.
Thank you.
Next.
Good afternoon, Madam Chair, Madam Vice Chair. Aaron Greenfield on behalf of Leading Age Maryland, a community of more than 140 not-for-profit aging services organizations serving residents and clients through continuing care retirement communities, affordable senior housing, assisted living, nursing homes, and home and community-based services. As the sponsor indicated, we are very supportive of this bill and are so supportive we wanted to be added to the advisory committee. So with that amendment, we fully support this bill.
Thank you very much.
Thank you.
Are there any questions for this witness? Seeing none, thank you for your work and thank you for being with us. This actually concludes the bill hearing on House Bill 354. Next, we have the last bill of the day, House Bill 368, Delegate Collison, Human Relations, Discrimination by a Place of Public Accommodation. Can you please bring your panel with you? And I believe that is Ms. Glendora Hughes and Mr. Sam Williamson. I'm sorry. Go ahead. How are you?
Good afternoon, Madam Chair and friends on HGO friends. I'm gonna start off asking for your intense indulgence on this bill. I hope that I'm allowed one rash behavior and then make up for it in the end. This is a case of what you see is not what you get. And let me explain what I mean by that. This summer, when I was thinking about reintroducing this bill, which this committee has seen at least 4 times, I took the bill back to put the discrimination in public accommodations back to the same stature as discrimination in housing and employment. And then I didn't do my homework. And so I apologize to you all for not doing my homework during the rest of the interim and working with the industries, because I should have done that. And I did talk with them last week, and what the bill is now, and it's in your floor system, it has been taken back to the 2020 version of the bill. And the 2020 version of the bill is fairly significantly different from what you've seen here. And the 2020 version passed out of this committee and also passed on the floor of the House. It did not get a hearing in the Senate, but it did come out of the House. So just to remind those, some of you were not here in 2020, and those of you who were, I'll remind you what it's for, what we're trying to do. I'm going to remind those of you, or tell you that those who don't know, I was a special educator in the public schools for about 32 years. And over my career as a special educator, I saw dramatic changes in how we treat folks with different kinds of disabilities. When I first started in 1978, I know now you can figure it out, right? In 1978, we isolated those students. We put them in separate classrooms. We sometimes put them in separate wings. And the same for adults. We put them in institutions. And then we began generally under the public law began to change. We began to say, wait a minute, these are folks who have potential, and we need to work with them to create that potential, or develop that potential and become their full selves. Well, and we've made a lot of progress in that area. I'm not going to say that we're totally there yet, but we have made a lot of progress. So what does that have to do with this bill? Well, in actualizing their potential, it means becoming active parts of our community, active participants in our community, people who can go to the theater, people who can go to a restaurant, people who can go to a retail store without facing barriers, and enjoy all of those things that those of us who are physically able, get to enjoy and take for granted. Unfortunately, we've made some progress there, but there's still some stigma around being disabled, and there are still barriers. So what this bill has attempted to do over the years is to raise awareness of those barriers and to help us, those of us who serve us in public accommodations understand that sometimes we need accommodation in order to be able to be successful in that setting. So what this bill does is, and the reason we changed it back to the 2020 bill was because that was the bill that recognized the hardship and burden that businesses face sometimes in providing these accommodations. So basically, what does the bill do? It says that if someone faces a barrier to a service in a public accommodation, they may make a complaint to the Maryland Civil Rights Commission. And they can currently do that. But if they do it now, and the commission does its investigation, and the commission levies a fine based on an intensive investigation, let me not minimize that, and the commission levies a fine, that fine goes into the general fund of Maryland. What this bill will do is allow those fines to come to the individual who has suffered the harm. But I want to be really, really transparent around the guardrails that we've put in here in this revised bill to say that businesses will not be overburdened. So what we're saying now is if the act through the investigation process, and let me tell you what I am told by our counsel, Glendora Hughes, is much of the time in the investigation process, these differences are worked out and negotiated out. But if they're not, and it's found that the act was indeed discriminatory, and that the business has not made any good faith effort to correct the issue, then it may go to an administrative law judge who will hear the case and make a determination whether or not there should be monetary relief for that individual, which would then go to the individual. One of the things that the administrative law judge is going to look at when they are making these decisions. So, and I need to be really clear about this because I don't want you to think that these are going to be capricious decisions, but they're going to make the decision based on the seriousness of the discriminatory act, the good faith of the respondent, the harmful effect to the public of a discriminatory act, the harmful effect on the respondent's actions on the investigatory process of the commission, and the respondent's assets. It is our expectation and intent that a small business would not be forced by an ALJ to spend more money than is appropriate for that size of business to fix the problem. I want to briefly give you an example of this kind of discrimination, which helps. And then what I think would have been a good faith effort on the part of the business. Someone went to a person who with a severe hearing disability, went to a fast food restaurant. They typed their order on their phone. They can't speak to the machine, right? Because they can't hear what the person is saying on the machine. So they drove up to the first window. They held their phone up with their order. The person said, I can't take your order. I can't take your order at the window. And they typed on their phone, why not? Here it is, it's right here. I'm not allowed to take the order at the window. So the person went and got the manager and asked the manager to come and said, please take my order. And the manager said, I can't take your order. I refuse to take your order at the window. And then the manager said, and if you don't leave, I'm calling the police. That's an example. It doesn't happen all the time, but it's pretty disheartening to the individual who is facing that. What could the manager have done? What would have been the appropriate action, right? Well, how about taking the order at the window? How hard would it have been for the manager to say, in this instance, we will make an exception because you are hearing impaired? And that's really the kind of, it's that level of sensitivity and thinking about how we can make those accommodations that I think is important. So we have a great resource in this state in our Civil Rights Commission, and they have to face these, deal with these extremely sensitive issues of discrimination all the time. But our current law kind of ties their hands around what they can do in these instances. So with this bill, I'm asking you to provide them with the tools they need to enforce our commitment as an inclusive and diverse society. And I really thank you for your consideration and request a favorable report.
Thank you, Vice Chair Cullison. Next, please.
Good afternoon, Madam Chair and Madam Vice Chair, members of the committee. My name is Glendora Hughes, General Counsel for the Maryland Commission on Civil Rights. We're the state agency that enforces the state's anti-discrimination law, which cover employment, housing, and public accommodation as some of the main features that we have. But this particular bill has been a continuation and attempt to provide equal rights for persons who are discriminated against under the public accommodations law. Under the public accommodations law, unlike housing and employment, there is no remedy for a person who's discriminated against. They may get an apology at most, but there is no relief. Presently, there is a possibility for ALJ to assess a civil penalty, but the money goes to the general fund and not to the person who suffered the discrimination. This bill covers all protected classes in addition to disability, physical, mental disabilities, but also other protected classes. We've had cases where persons, because of race, are discriminated against, because of LGBTQ are discriminated against, because they're a woman, they're discriminated against. And this bill will provide some measure of remedy and relief for those victims of discrimination. It requires that, first of all, that it be proved. It's not just simply they file a complaint and there was a fine. They have to prove that there was discriminatory intent, and then they have to prove what harm they suffer. This bill provides that guidance, that guideline in terms of how that remedy can be assessed, and gives direction to the ALJ in assessing those remedies. And for those reasons and any other, and what ditto to what the delegate said, the Maryland Commission of Civil Rights asked for a favorable report on the now amended bill.
Thank you, Director Hughes. Next, please.
Thank you, Madam Chair and members of the committee, for the opportunity to share my support for HB 368. My name is Sam Williamson. I'm a staff attorney at Disability Rights Maryland. DRM is a protection and advocacy organization for the state of Maryland. Our mission is to protect the civil rights of people with disabilities. We strongly support the full inclusion of people with disabilities into all aspects of community life. Discrimination by places of public accommodation continues to isolate and harm people with disabilities. DRM represented a child who was rejected from a camp because the child needed anti-seizure medication. The camp refused to provide any reasonable accommodations and told the family to find another camp. The family was unable to find a place for their child, and the child was unable to join their peers. Having the remedies provided in this bill could help families like this one better afford childcare if a camp refuses to enroll their child, or perhaps pay for a more expensive camp that will provide reasonable accommodations. This type of discrimination occurs across many different areas. DRM has also represented a young girl who was denied the opportunity to roller skate with her peers because she needed to use a walker on the ice rink. We've also seen discrimination in public buses, where a bus driver stopped announcing bus stops to a blind passenger, causing the passenger to ride all the way to the end of the line and have to backtrack to get home. This bill will not only help address the harms that people with disabilities experience, it will help prevent these harms from happening in the first place by providing an incentive to comply with Maryland's anti-discrimination laws. DRM asks that this committee help shift the burden from those being discriminated against to those who are continuing to discriminate. I ask you to issue a favorable report on HB 368. Thank you.
Thank you. I'm going to, and good afternoon. Nice to see you, Ms. Hughes. Nice to see you, Sam. The first question is Delegate Morgan.
Thank you, Madam Chair.
I'm a little slow. I don't know what happened there. It's like I froze for a minute.
I do that at least 3 times a day. Thank you. I remember we had this bill a few years ago, and there was a lot of discussion. I guess one of my issues with all this bill is we ask businesses to hire and sometimes shield suspect employees. We ask businesses to hire people with past criminal records, and we shield employees for doing background checks. This bill would make the business owner responsible for their employees' actions, even if they were, reprimanded or even fired. I guess my question is, under the scenario that you said about the manager that didn't fulfill the order at the fast food restaurant, like, we don't know whether he was actually discriminating against that person, or do we know that he was just busy and frustrated and just made a bad decision or just bad customer service? So in that scenario there, how much would that business have to pay because if found guilty? Because I'm looking at the legislation for employees under 20, it looks like it could be, that business could be fined up to $50,000. Isn't that so?
Well,
It may not be so.
it may not be so. Well, partially because there's been an amendment to change that. But first of all, there will be an investigation. It's not just an assumption that there was a violation of, that the manager was discriminating or the employee was discriminating. We would take the complaint and conduct an investigation to determine what exactly took place. That would involve interviewing witnesses, that would be involving what are the policies. It may turn out the remedy is training and correcting so that this doesn't happen again, making folks aware of what their responsibilities are. And in terms of damages, it as in all damages cases, you've got to prove the harm. So it's not merely because you file a complaint, you get X dollars. There has to be a showing to the judge, even to the commission, what exactly were you harmed. It may be a very limited fine, but most people, and particularly in public accommodations, they just want the action to stop or that the barrier be removed so they can have access like everybody else. So it's not just simply file a complaint and then the business has to pay a fine. That's not how it works.
Sure.
Is there an appeal process for the business? And also,
Yes.
can you, is there any countermeasures the business owner could utilize in case there was discriminatory practices from like the activist community? They're out there just making these complaints frivolously.
No, we don't. One, the reinvestigation does eliminate any so-called frivolous complaints, but most of the cases we get are not frivolous. Someone feels they were harmed and that there is a determination, is there probable cause that discrimination has actually taken place. Then once there's probable cause, there is always built in our system negotiations to try to settle the matter before it can go to an ALJ. If it fails conciliation, where both parties can't come to an agreement, then it is sent to my office, general counsel, to file for the case to go before an administrative law judge. And even then, when we get the case from investigations, we then approach the parties in terms of resolving. Many of the cases have resolved. We have not, even in employment and in housing. There's a low percent. There's a financial interest in employment and in housing. And many of those cases, very few turn to probable cause cases because we are able to settle them during the investigation process. So only probably the most contentious or the most complex cases get certified for public hearing and sent to my office for litigation in comparison to the volume of cases we receive by people filing. And that's the whole purpose of our process, is to conduct investigations determining whether there's no probable cause or probable cause for the person filing a complaint. And even in the process, there are rights of appeal that a respondent has in our process if they disagree with the decision.
Go ahead.
A couple of years ago, you gave a very, when you briefed the committee, the Civil Rights Commission briefed our committee, you had a very good book that was talked about the amount of complaints you had versus the amount of
annual report.
Yeah, commission per county. Do you have any type of updated data
We
that
do.
you can share with our committee?
I can have someone send you a link to our new annual report. And it does break down the number of complaints. And as you said, by county, by types, by employment, what basis, it has all of that in there.
Will you be so kind and send it to the entire
I
committee,
will
please?
definitely make sure that they'll hand deliver all of them down here to you.
Thank you. And may I just follow up as a clarification? to Delegate Morgan's questions, can you explain how the amendments take care of the fine, please?
From what I've read in terms of reading the amendments is that first, it's graduated based on how many times the entity has been, in the first part, how many times the entity has had complaints filed against it. So if it's only the first time, there is a max of up to $1,000. That doesn't mean they'll get 1,000, but if you improve, up to $1,000 is the fine. And then if there's repeat behavior within a 5-year period, then it increases. If it's repeat behavior in a 7-year period, it's increasing. So hopefully there won't be that. The other two numbers won't come into play because the person has corrected the problem and with the employee. As it comes to the employee committing a violation, it is up to, again, the monetary relief up to the $25,000. That's the cap. That's not what they get. The person, like in employment or any other case, you have to put on evidence of the harm that the person suffered, and that the administrative law judge has to use the criteria that the delegate Collison read in making that analysis. They have to be, the administrative law judge has to consider the seriousness of the act, the good faith of the respondent, the harmful effect to the public, and as important, looking at the assets and the harmful effect on the investigatory process. So there's a lot that has to go into before there's a final award given to the person that is a victim of discrimination. I know we're emphasizing what happens to the business, but we also have to realize the purpose of the law is to provide relief for somebody who has been discriminated against, somebody who has suffered harm, somebody who's been asked to get up out of a restaurant because we don't serve your kind. We have had those. Somebody who's gone out on a date and can't get into the restaurant has to go around the back and come through the kitchen because it's not accessible. Somebody who went to a gas station and was spit upon. Those are real harms that happen to people, and we also have to balance that too, that there is, if there is acts committed by a business or their agent, that there should be a relief for that person who has been harmed by the violation of the law.
Thank you. Delegate Shalega.
Thank you, Madam Chair. I miscalled you, Madam Speaker. Some of my questions were answered by your response to Delegate Morgan, and I am interested in the total number of claims. And of course, I thought the purpose was to stop discrimination.
Yes.
Well, you just said it wasn't. You said the purpose was to get people money who were discriminated against.
No, what I'm saying is that I was doing that in comparison that we're emphasizing protecting the businesses, but I'm also saying we're looking at protecting the person who is harmed. But
protecting businesses who discriminate against people. So I don't think that's fair.
No, that's not what I'm saying.
Okay, clarify, please.
I am saying that a business that has been proven and shown to have discriminated against, and that the harm happened to this particular person, that we're asking for a relief for that person who was harmed by the action that took place in that in violation of discrimination law. We have to show, we have a standard, we have legal standards that we have to do analysis to show that what happened, what action that took place in that business reaches the level of what the law requires to prove intentional discrimination. If it doesn't meet that level, we find no cause. And a large percentage of our cases turn out to be no cause. Those cases that do turn out to be cause, where we find sufficient evidence that establishes that there was a discriminatory act, then the matter goes before an administrative law judge. We have to put on evidence to that judge the business has an opportunity to rebut that evidence, and the judge makes a decision whether or not there was a violation of the state law of protecting persons against public accommodations discrimination. And if so, we then also have to put on evidence to show what did that person suffer? Evidence that there was harm, and there are limits based on this bill of how the top cap of how much the person would have to show to get. They don't necessarily will get the 1,000, they may get 100 based on the evidence they put forth. If they don't put enough evidence, there may not be a monetary remedy that is provided by the judge. It may simply be an educational piece where the judge orders that there be training for that entity, which happens a lot. And even during our investigation process, again, very few cases reaches me for litigation. A lot of it gets resolved in the investigation process, and many of it is, can we show you how to correct this? Here is training that should be had so that this doesn't happen again. Our goal is to keep it from repeating, keep from both the business from best practices so that there isn't any violation, and also protecting the citizen of Maryland from being discriminated against. That's our goal.
Yes.
To follow up, thank you. I understand that, and thank you for the clarification. And of course, we all agree that discrimination is wrong, and that's why you're there. But it sounds like it's working. You just told me it's working, that hardly any cases get to you. So that's good. That means that complaints that are brought against businesses or people that would be discriminating against others are your investigation. If they find them to be of substance, they're taken care of, and then a very few of them reach you. And by the way, Vice Chair, none of that's on here. So I can't see on the system your amendment to read what you're talking about. So we'll need a copy of that. I'm just going off of your oral testimony here, and I'm sure the fiscal note needs to be updated. But so it says in the current fiscal note that you may assess a civil penalty between 500 and 2,500. So you're telling me that's not adequate, because again, you said the purpose of what you're doing is to stop discrimination, which we all agree is awesome. So is this not enough? Are you not feeling like this penalty is not large enough to stop discrimination? Are you seeing more and more and more, and that's why you're here?
Two things. The civil penalty does not go to the victim of discrimination. I mean, the present
discrimination, is it not working?
Let her finish the
Okay.
answer. Go ahead.
The civil penalty goes to the state. Doesn't go to the victim of discrimination. They may get a letter of apology, but that's the most that they'll receive. This provides relief for those persons who the matter cannot be resolved, and the person has suffered harm, and we find probable cause of discrimination. The respondent or the business doesn't want to settle it, and the matter goes before an administrative law judge. And as in employment, as in housing, the opportunity is there for that person to prove their case of discrimination, and for the business to rebut that discrimination, and the judge to make a determination that discrimination did take place. And this is an option for relief. Public accommodation, there is no remedy for in terms of monetary relief for the victim. It is existing in employment. It does exist in fair housing. It does exist in other parts of our statute, but in public accommodations, if you are filing a complaint of discrimination, there isn't a remedy for the victim.
Yes. Thank you. Appreciate the time. So if this bill passes, would you be willing to entertain an amendment that would say if the person that is on trial or the business, because it's not just businesses, it's people that can obviously be sued or, it'll be sued in this case. Could they gain relief for their legal fees from the person or the commission? If they're found innocent and they've spent 30,000, 50,000 on legal fees to defend themselves, would you be willing to then quid pro quo say, we'll grant you relief because you were successful in defending yourself, you were found not guilty? Should the door swing both ways?
There is no attorney's fees in either, for either side.
They don't have an attorney represent
There,
them?
there's no, most of I can't think of a case where very rarely have I seen an attorney represent a complainant in a public accommodation case.
Not a complainant. The defendant.
And a defendant, many times when we are dealing with businesses, very rarely do they have counsel. They particularly those who want to resolve it. It's resolved during the investigation. Very rarely do they have counsel. Now, when the matter goes to possibly to litigation, counsel may be hired to participate in a litigation. But during our administrative process, both parties many times are not represented. Unlike in the employment and in housing, you do see counsel in those arenas, but you don't see we don't see a lot of attorneys representing folks before us in public accommodations.
Thank you. Delegate Chisholm, followed by Delegate Riley.
Thank you, Madam Chair.
You're welcome.
It was mentioned in testimony, we're talking about repeat offenders.
Mm-hmm.
And when we're talking about cases where you've seen calls with repeat offenders, what percentage of cases where you've seen calls was it actually repeat offenders? And what I mean by that is, are the corrective actions resulting in eliminating the discrimination, or is it the same 5 or 6 bad actors that you've seen?
In public accommodations, it's I can't pull up a repeat offender. Usually, the matter, if it's litigated and the judgment is paid, or the judgment that the relief is given, that we very rarely see. We may, I think, in housing sometimes we see repeat offenders, in employment sometimes, but in public accommodations, I can't really name or think of a repeat offender. Particularly, a lot of the cases are dealing with accessibility issues, and once the area is removed, then and this particular, I think the amendment provides a point where if allowing for the fact that there would be no monetary relief if the business removes the obstacle or makes itself accessible, then there would not be any immediately, if there would not be any, the commission cannot request monetary relief if that is fixed. So I can't think of a bad actor that repeated. No.
Question is, I feel like most businesses will make adjustments or changes because no business wants to discriminate. Maybe there's some idiots out there, but I will say,
yes, there are some.
All business owners, there's employees, and employees make mistakes. And my concern is we could bankrupt a business. And I know you said that, well, you don't need litigation. A lot of times when things come to you, they simultaneously go to the EEOC, and I would highly recommend.
This would not go to EEOC.
They end up with the EEOC because people.
This is public accommodations.
I understand. Okay.
It would not go to EEOC. Public accommodations would just stay with us. There is no federal counterpart unless someone goes to the Department of Justice, but there's no like housing and employment. Like housing, there's HUD, and with employment, there's EEOC, but not with public accommodations.
Thank you, Madam Chair.
And just for clarification, this bill is for public accommodation, and currently the law does not allow a victim to be able to get compensated for their injury, correct?
Correct,
And what this bill does, it would add that.
correct.
Okay, Delegate Riley.
Thank you, Madam Chair. Yeah, as I'm listening, okay, so between the introduction of the bill, reading the bill, and listening to some of the examples that we heard today. First of all, in the bill, I don't see the word disabilities at all in it. I do see the word discrimination. So I think we're kind of mixing disabilities versus discrimination, a combination together. I could have, I haven't read it, you know.
It's a
word from
protected
word.
class among many.
Okay, and do we not have an agency currently in the state of Maryland that deals with disabilities? And, you know, whatever would happen with that group of people that.
There is the governor's office for disabilities, but this is a different, this applies to discrimination, which is different from what they do. This is an enforcement bill in which the state of Maryland utilizes police's powers, prohibits discrimination based on protected classes, race, sex, religion, etc. And physical and mental disability is a protected class under this statute.
I do understand this, but since I'm sorry, Madam Speaker, can I, with the disability. So, I mean, currently we do have laws for, you know, what businesses can and cannot do and accommodate the disabled. I agree. We probably don't have enough of those. Matter of fact, a couple of years ago, I had a bill put in that our hotels had to have a certain amount of rooms so that someone that is disabled, because I have a stepfather that is totally disabled and in a wheelchair. And if he went to a hotel, he could not get up on the bed. So we put in a bill, myself and the good senator, which passed. You know, we had to extend it because of I guess the concerns that the hotel industry, but we finally came up with a compromise, you know, so this can be extremely expensive if you're putting in the disabled in with the discrimination, because I'm sure all of them have been somewhere along the line discriminated, and those businesses cannot do most likely what you want them to do overnight. Because those laws were never on the books.
With all due respect, Delegate, it's already in the statute. Disability is a protected class. Physical, mental disability is a protected class. And and businesses are required to not discriminate based on physical. What this bill is not dealing with the substantive part or adding disability in it because it's already there. This bill is looking at remedy for those who are discriminated against. And it's not just persons with disability that are covered, but it's also persons that based on their religion, based on their being LGBTQ, based on being African-American or Hispanic, who are treated differently or discriminated against when they enter into a business or a doctor's office or something to that extent.
My point is that there's certain things that businesses over for eternity, you know, from past to current, that someone with a disability could say, hey, they have to provide this, but yet under the law, because it has been unreasonable for all of them to do all those things, you know, to satisfy everyone 100% in every kind of business. So don't you see, this will be my last question, don't you see the impact of what this would be if the entire community of the disabled community, and believe me, I think we should do a whole lot more in our business, but if the whole community would come forward and say, under this bill, I've been discriminated, because basically, ultimately, I guess you can say, yes, they have been, because we haven't provided certain things in each kind of a business. But what all these places would have to do to meet the qualifications of this, I just don't see it. I mean, it would be billions and billions and billions of dollars if you add them all together for all these businesses. So my last comment.
This bill doesn't change anything. It does not add additional burden to businesses. There is also the ADA that is out there that federal law that you're required to comply with. But this bill doesn't change and add any additional violations or anything to, because it already, the protection, the discriminatory protection already exists. We already, and the way the amendment is written is that unless the business doesn't refuses to make corrective action or is recalcitrant, there would be no monetary, the commission, they would be in violation not only of our law, but federal law and not being accessible. It's reasonable accommodation. It's not automatic. You get exactly what it's reasonable. And right now, we do work with businesses and how to fix if they can. If it turns out that it cannot be done, or that it's an undue hardship where it costs more than what the business can afford, we have found no cause. We have found no cause in several cases where we determine financially the business cannot make the accommodation.
So just for clarification, the law is reasonable accommodation.
Yes.
Not necessarily that you must do it,
Yes.
right? But when it
Yes.
is not reasonable,
Then
right? When it's egregious, right? A lot, then it does not allow it.
Yes.
I don't see any other questions, so I'm going to, okay, Rosenberg. All right.
Thank you, Madam Chair. Is it,
You're welcome.
is it fair to say that the history of our civil rights laws, starting at the federal level 60 years ago, I just realized this year, has been one of saying certain actions, whether it's public accommodations, housing, so on, are illegal if they discriminate against people of certain classifications. And over the years, over the decades, both the Congress and this legislature and legislatures and city councils all around the country have provided additional protection to additional categories. And that's in part significantly what this bill would do. And part of that is a history where in 64, gender was added as a joke to kill the bill. And now it's enshrined in the law and also in case law. Is that a fair characterization that what we've done over the years is add protected categories to the framework that was built initially at the federal level and after a lot of disputes at this level before in Maryland before then, where certain counties exempted themselves out of the civil rights law? Is that a fair characterization?
It's a fair
Thank
one.
Thank you. So I don't see any other questions. I do have one clarification. You testify not on the bill we have in front of us, but on the bill from 2020, which probably people do not have, and the amendments as well. In 2020, since you're testifying on that bill, and that bill passed the House, and I see the unfavorable from the industry, if it's on the 2020, they were on board, are they on board on the 2020 bill?
They were talking with their boards yesterday and I don't
Okay.
have final information on that. So
Okay.
We'll hear when they come up.
So when they come up, I'd like them to testify on the 2020, assuming we have the 2020 bill and the amendments, okay? As well. Thank you so much for your testimony, all right?
Thank you.
And will you
Chair.
be so kind, can I ask you something? Can you please, Vice Chair Collison, send everyone on the committee the 2020 bill?
The amendments, I will do
I'm
that.
sorry, the amendments.
Yes.
To make it to that 2020 bill.
Yes.
Can you do that, please?
Yes.
Thank you very much. And then Ms. Hughes, please deliver the reports
Yes.
to everyone,
Yes.
okay?
Yes.
I appreciate it.
They'll be brought down tomorrow.
Thank you. Thank you for your testimony. We have next Ms. Kaylee Locklear, Melvin Thompson, and Mike O'Halloran. And again, if we can focus on the amendment, okay?
You got it.
Thank you very much, Madam Chair, Madam Vice Chair, members of the committee. I'm Melvin Thompson. I represent the Restaurant Association of Maryland. And we did sign up opposed to the bill that is introduced this year. However, we expressed our concern to Vice Chair Cullison. She met with us immediately and explained to us what had happened. We went back to our legislative committee, explained that. She agreed to put in the bill language from 2020. In 2020, we withdrew our opposition after working with Vice Chair Cullison on the bill to get to a point where we could accept that language. And if those 2020 amendments are adopted to replace this bill language, we would again withdraw our opposition. And I just want to say we sincerely appreciate working with Vice Chair Cullison. She always keeps her word. She always tries to work with all stakeholders to make sure that we reach compromise. She's done that again, and we sincerely appreciate it. Thank you.
Thank you for being flexible. And I know it's not just working with Vice Chair Collison. I know some of the members here, they have bills that affect you and you have been meeting with them.
Always.
And I
Thank you,
send
Madam
them
Chair.
your way right away.
Thank you. Always. Thank you, Madam Chair.
My pleasure. Next, please.
Good afternoon, Madam Chair. For the record, Mike O'Halloran here on behalf of NFIB in Maryland. Likewise, I want to echo the sentiments of my colleague, Mr. Thompson from the Retailers Association. A special thank you to the Vice Chair and the sponsor of the bill. As was the case in 2020, should the committee, in its wisdom, adopt the amendments that have been discussed here today, NFIB would also be in a similar posture of removing its opposition as we did in 2020.
Thank you so much for working with all my members. Next, please.
Absolutely, Madam Chair, Madam Vice Chair, honorable members of the committee. For the record, Kaylee Locklear here on behalf of the Maryland Retailers Alliance. I'll keep it brief. Ditto. Thank you so much for working with us on this, and we do remove opposition if the amendments are adopted on the bill.
Thank you again for working with all the members on the committee. We really appreciate it. You know, when you put in these bills, as soon as I am aware of it, I go, they're gonna be against it. Go talk to them. Don't surprise them, because you do have to do a balancing act, okay? It is important, right? It costs money to have a business, to build it as well. So thank you for finding a reasonable, solution here. So thank you very much. Any questions for this panel? Seeing none, thank you so much for your work and for
Thank you, Madam
always
Chair.
being
Thank you.
available.
Thank you.
Okay?
Thank you, Delegate Cullison.
This actually will conclude the bill hearing on House Bill 368. Yeah, so we have, before we go offline, we have a couple of announcements. And after we go offline, can you stay on in your chair for a minute? Delegate Kerr.
Thank you, Madam Chair. The Government Operations Committee will have a continually shrinking list of bills to consider tomorrow. I think we're down to 2, but we'll take care of those tomorrow at 10 a.m. prior to the State of the State address.
And Kathy says, good.
Yeah.
I
Thank you.
have a couple of announcements. Well, I'm gonna do one offline, but the first one is happy birthday, Delegate Morgan. Can we, we wish you a happy birthday, many, many more years with good health, okay? Absolutely, you got it from all of us here, a lot of prayers. And I want to thank everyone for being patient and hanging in there today. As you know, the days are gonna get longer, and after tomorrow is the State of the State, but then we're gonna really ramp it up. So if you could please be available, come on time like you have been doing, which I'm so grateful. And we will try to get out of here as soon as we're done, okay? And I hope you have a blessed evening. Thank you so much. And thank you to staff for being so flexible with everything.